Okay. And we're good, you're on, good on the recording
good,
piece?
yeah.
Okay. Welcome, everyone. With a posted time having arrived and a quorum of the council present, I will call our Committee of the Whole for Monday, July 15th, 2024 to order. Tonight's meeting is a Committee of the Whole. It's the Wausau Common Council acting as a committee. We're not acting as a policymaking council. This session tonight is information and discussion only. It is not an action session. So I want to be clear that no new policy actions will be taken coming out of this meeting tonight. What we have here is really a point-in-time snapshot of the work in progress. And our Committee of the Whole meeting is convened at the request of two of our council members from a month or so ago that we're looking for updated and current information on where we are at with our local response to homelessness. That request, though, is voluminous in nature, and so the mayor and I took that request and we have split it into two parts, a part one and a part two. Part one is tonight, which is really a snapshot, a point-in-time look at the work we currently have in progress and what we're seeing in terms of successes and challenges, both from our city departments, from the county, and from some agencies that work with the unhoused community in terms of sheltering. So we have that. The reports that we would ordinarily receive in public health and safety from our outreach officer, Tracy Rieger, those were held at public health and safety for this meeting so everyone can hear those together. So we have that as well. Part two of this session, we've got an outline of the response within city departments. We've got some comments from our county administrator on some things that are happening at Marathon County, and we do have some agencies. Item 2 on our agenda is really kind of a free-flowing idea share among us. And I guess if you think about the idea share and the way we did it at the council retreat, after we hear the presentations, we'll be looking for some discussion of what, kind of a what next type dialogue between all of us as far as what we feel like the next steps are, and what we would like that path forward to look like. After that session, then we will take all of that feedback and we'll sort through that. And what will happen then is a part two Committee of the Whole that will happen in the fall, where we will be presenting some hopefully viable options going forward that we can digest as a group and maybe choose among some things that we want to look further into or know more about. So if you bear with me on that, we do have some invited guests. The one thing I will ask, though, is that if we have questions of our invited guests, that we are first respectful of the time that this meeting will take. We want to try to cap this whole thing down in 2 hours if we can. Less if we can, but probably not try to exceed 8 o'clock. We also want to be respectful to our invited guests who've taken time out of their evening to come and share their information with us. So the first facet of this, of item number 1, is presentations on work currently taking place from a number of perspectives. The first one is work to address homelessness by city administration, city departments, and the Public Health and Safety Committee. So within that, we have 5 presenters that will bring you up to speed with the way things are with the work at the city level. We'll work through that first, and then we'll go to another facet. So first up on our agenda is some feedback about our Affordable Housing Task Force and affordable housing projects that are in progress, completed, and planned. And with that, I'll bring up Interim Community Development Director Randy Feifrick. We made him first because he does need to leave this evening for another engagement. So welcome, Randy, if you could just walk us through. He did distribute a handout at the beginning of the meeting that you can digest at your leisure as well that outlines some of what he's going to talk to us about. So welcome.
Thank you for the opportunity. One of the things that I mentioned, I was handing out the summary that I created as I was putting together my thoughts for it's a lot easier to get this written down. We have a lot here. I could have probably put in 10, 15 pages together, but did our best to summarize what we have available. Overlying, our goal is quite simple. It's adding additional infill affordable housing within the city. That's all what we're trying to do with these projects. We're going about in a number of different ways, and I'll walk you through some of these different projects. First is Westside Commons. That's the Gorman project. That was RFP'd in September of 2021. Project location is 415 South First Street on the former West Side Battery and LS Printing property. Project consists of 56 units with a combination of 1, 2, and 3 bedroom units. Housing tax credits were secured for the project in 2023, and the development agreement was formalized in March of this year. Happy to report that things are moving forward on this project. We have a closing date anticipated of July 31st, and we'll start construction soon after. Ideal construction completion would be December 2025 based on the tax credits that they've received. So that's moving forward. We're very excited to see that. In the next month, you should start to see some real construction out there. 700 Grand Ave, that's Commonwealth project. That was RFP'd about a year later in August of 2022. 700 Grand, which is just south of our downtown. Project consists of 50 units, similar mix, 1, 2, and 3 bedroom apartments. Housing tax credits were secured on this project in the spring of 24. We have run into some escalating estimated costs with the utility relocation, which has jeopardized the project, and that'll be something that we'll have to talk through with committees as we move forward. The infill housing, those are the city-owned parcels on Jefferson Bridge and Thomas Street. The city released a request for bids on parcels on Jefferson Street and Bridge Street this spring for construction of single-family housing, but we did not receive any bids. We are working to refine the request for bids to clarify some items that created confusion amongst potential builders. Just last week, Habitat for Humanity expressed interest in 2 of those Jefferson Street lots. We plan to release an updated request for bids in the coming weeks. If Habitat moves forward, we plan to move forward with a bid package that would include the Bridge Street as well as 1 parcel on Thomas Street. The request for bids will require some contingencies, specifically on the Thomas Street lot, as we wait for the results of the DNR environmental assessment. Finally is the multifamily housing. We're still looking for a larger site to fit this. 6 to 8 unit apartment. We were looking at Wyatt Street for this. Currently working to find a home for this project. Also included some funding components of this. I won't go through that at this point, but these are the funding components that are very pivotal in being able to bring this forward. We're trying to be conscious of general fund TID use. So we have some real opportunities with the ARPA funds for affordable housing that were designated, as well as the affordable housing TID extension. With that, I'll take any questions.
Great. Thank you for that. Does anyone have questions for Randy about the affordable housing projects that are currently in the hopper? Now, obviously, if we add these all together, assuming that they all come to fruition, it is a decent number of affordable units that we don't have today. But obviously, building things always takes time. Alder Neal.
Thank you, Madam Chair. Regarding ARPA funding, because this might come up in discussions going forward. Where are we at in terms of available or stuff that we can go after that we haven't used or what have you? I mean, what's our resources looking like?
Yeah, so the city allocated about 1.1 million of ARPA money for affordable housing last year. At finance last week, I believe it was last week, we talked about how we would potentially reallocate that to the CDA. Just based on the requirements of ARPA and the deadlines associated with it, it doesn't make any sense for us to hold them because we're not going to be able to make use of them before that deadline. By utilizing the CDA, Mary Ann's gone through that and found a way that we're able to save that money for affordable housing. All these projects I'm talking about, there's not going to be any checks that we're going to be able to cut by the end of the year. Even for the infill housing projects as we get bids, because they're going to be working on them, but they're not going to have construction complete until 25. Mm-hmm. So it makes the most sense to be able to utilize that money in the future by partnering with the CDA on that.
Right. The last thing we want to do is return federal funding when we can be making an impact with it. Anybody else have questions about Randy's report? Alder Larson.
Thank you, Madam Chair. This sewer pipe for the 700 Grand Avenue, what kind of delays and stuff is that going to create?
Yeah, I can talk about it a little bit. So when we went out with the RFP, we realized there was some infrastructure, sewer main, as well as some water lines that crossed that property. Worked with engineering. They came up with some proposals on that pretty early on in the process. We did come through and submit an ARPA request, which I believe that was last year, that didn't go through, with the idea that we wanted to wait to see if the tax credits were approved. For that specific project, they had originally applied in 2023 for tax credits, were not awarded. So in 2024, this spring, they were awarded. So with that, as they got into more detailed engineering, they realized the original cost estimate was low. So now we're looking at substantial more costs for that relocation. That's one of the biggest issues with the project currently.
Okay. So there's definitely some things to be hammered out on that. Any additional questions? If not, then we'll place Randy's report on file and we'll move to the next component of this. And we recognize that affordable housing is really a key component of both addressing homelessness and preventing it. So we'll place that report on file. Second up from within the city's realm is Wausau Police Chief Matt Barnes. If you'd like to come up and walk us through a few things you have going on.
Good evening. This is pretty exciting. I think we've talked about this for a long time. My goal tonight is just to talk about some of our experiences, some of the things that are in process for us right now. Some are gaps and some are successes. So the first thing I want to address, and part of it is I think within the lane of the police department, and the other half because of our experience, but the other half is definitely in the lane of the council. We continue to see an influx of unhoused individuals in our community that are arriving here in one of two ways. They're either migrating by their own actions to our community to be homeless here, or they're being transported and delivered here by other municipalities that surround us. Some close municipalities and some extended municipalities outside of our county. That's something that the law enforcement is having to deal with, and we deal with the challenges that come with those individuals. What I see as an opportunity and essential is for us as a community to develop partnerships with other municipalities in regards to funding. One of my favorite examples of that is Salt Lake City. Our deputy chief spends a lot of time out there, or did, saw a program that was working in that community and researched it. And what they do in that area is the resources are all in Salt Lake City, but all the surrounding suburbs and municipalities all pay into a pool to be able to provide those resources, so that when they're delivering individuals to the resources, they're active participants in delivering those. And that just makes a lot of sense to me. It is very difficult when other communities are delivering unhoused individuals, and those are individuals with challenges that their law enforcement agencies are dealing with, and then they instantly become issues that we're dealing with as your Wausau Police Department. And the solution to me is partnership with everyone that shares some of that load. The second thing I wanted to talk about, which I think will be a recurring theme that you'll hear about, is a significant gap. The Wausau Police Department houses Tracy Rieger and the work that she does, and she's one of the most tireless working individuals that you have as a city employee. And she houses a lot of people, but one of the things we've learned over that time is that just housing someone is no guarantee of success. And so as we evaluate that, we're not rocket scientists, but we recognize that you can't just housing someone. I wouldn't bet on that being successful. That's the transitional housing component that steps people into the skills necessary to live successfully on their own. And so I know I've presented to this council before on some proposals for transitional housing programs for women. I still believe the key to a successful population control of unhoused is kind of the functional zero concept, that we're always going to have new people that enter homelessness, but we should be at a speed that has people leave homelessness at a comparable pace. And if we can do that, that leaves us with a number of individuals that's manageable for us. So I am a significant advocate for transitional housing. One of the challenges was how do we pay for something that is very expensive? I have applied for congressionally directed spending, and I'm working with Senator Baldwin's office. We've successfully taken every step necessary and are still in the running for congressionally directed spending, which would bring hundreds of thousands of dollars into this community in order to start some of that programming and fund other partners with that. The third thing I want to talk about is our team of officers that have been spending time working downtown. I'll just number one, start with, they spend just as much time helping individuals get resources and pointing people in the right direction. And we've seen significant success that you'll probably hear a little bit more about from another presenter with the partnership between our office and the district attorney's office in their diversion and deflection programs. So there are individuals today who are in rehabilitation addressing AODA and mental health issues that would not be there if it wasn't for their interactions with law enforcement. So there's funding available for that, and this is a program that has proven to be very successful. So when we're engaged with individuals who are breaking the law or violating our ordinances, those are individuals that we start with diversion and deflection to figure out what is it that they might need. Are they eligible? Can we make a referral to the deflection program and get that individual into resources? And sometimes it comes with, there's two doors. One is the criminal justice system and the other is the deflection program and participating and receiving resources. I'm pleased to report that many individuals who are high utilizers, there's 4 of them right now that are in rehabilitation and receiving services that we're just very confident they wouldn't be. I would also say that I've received more phone calls from downtown businesses as well as citizens who either live or recreate or shop downtown. I've received significant positive feedback about the quality of life downtown. And I don't think it's any one particular thing that we're doing. I think in law enforcement, we see the first step in our use of force is just presence. And so those officers being downtown in those businesses, engaging with individuals, has the same effect that parking a marked squad car on a road does. It slows everybody down. It gets people to obey the laws. And we're seeing some of that effect downtown. So I'm incredibly proud of the work that they've been doing. And I think it's a little premature for me to stand on the aircraft carrier deck and declare mission accomplished. But we're headed in the right direction, and I look forward to seeing continued progress with that. The last thing, and I spoke a bit about diversion and deflection. When we find something that's working, like we don't need to reinvent the wheel, and the diversion and deflection programs, in my opinion, have been very successful. The Marathon County Sheriff, Chad Billop, and I have both signed on to a grant application from the District Attorney's Office to dramatically increase the deflection program. It would be allocating staff from the police department that would be funded by this grant, as well as staff from the Sheriff's Office partnered with deflection staff. And that requires them to go out into the community, and it's not always waiting for someone to commit a crime and then trying to deflect them out of the system. It's identifying those individuals who are violating the law and get in touch with them before there's an arrest to help motivate them into appropriate treatment. And with deflection, it's not homeless deflection or unhoused deflection. It involves individuals who are dealing with substance abuse issues and trying to mitigate the consequences of substance abuse issues. And so given the amount of overdoses we've had and the impact of those drugs in our community, as well as in the unhoused population, I'm pretty excited to see how that grant turns out for us. And lastly, which is kind of a setup for the city attorney's office, the Supreme Court ruled on grants pass. And my phone immediately rang off the hook saying, did you see this? Did you see this? What are you going to do? And I'm just here to tell you, nothing right now. If we're going to change how we handle the issues addressed in the grants pass decision, that's going to be direction that this council gives me for the department. So the way in which we would handle removing encampments from parks or individuals from public property, we worked with the city attorney's office to develop a program which was in compliance regardless of which way the Supreme Court ruled. So we have a pretty extensive program of notice, and working with the unhoused population or that are in these encampments requires notices, posting. It's a 14 to 15 day process. It's working. I feel fine with that. I don't see any reason, regardless of what the Supreme Court ruled, to change anything immediately just because they had a ruling. So it is not my intention anytime soon to use that Supreme Court ruling to change how we handle those things, because I feel pretty comfortable with where we're at. So any direction moving forward will be sometime in the future, and it'll be at your direction. So now I'll answer questions.
Thank you for that. Does anyone have any questions for Chief Barnes about the materials that he is managing? That means you covered it well.
Thank you.
Thank you so much. Okay, so the chief kind of teed this up. Our next presenter is City Attorney Ann Jacobson to give you just a brief synopsis of what Grants Pass was and what it means for municipalities. So welcome, Ann.
Thank you. Good evening, Madam Chair and Mayor and the rest of the council. So in a recent decision, the U.S. Supreme Court ruled that cities can enforce public camping ordinances without first demonstrating that adequate shelter was offered to a person and that person declined it. This means that local governments now have the discretion to regulate camping activities on public property, including parks and sidewalks. Violators may face fines, and repeat offenders could be banned from city parks for up to 30 days. The City of Grants Pass, Oregon versus Johnson et al., on behalf of themselves and all others similarly situated, was decided by the U.S. Supreme Court on June 28th of this year. I'm going to include just a few minutes of a bit of a factual backdrop in the procedural posture of this case, and I'll be quoting almost entirely from the court syllabus. So these are their words, not my opinion or anything of the sort. Grants Pass is home to roughly 38,000 people, a city very close in size to our own, 600 of whom are estimated to experience homelessness on any given day. Grants Pass has public camping ordinances, and still do, that prohibit camping on public property or parking overnight in the city's parks. So there's three parts to their ordinance. The first part prohibits sleeping on public sidewalks, streets, or alleyways. The second part prohibits camping on public property, which is defined to mean setting up or remaining in or at a campsite, which is any place where bedding, sleeping bags, or other material used for bedding purposes, or any stove or fire is placed for the purpose of maintaining a temporary place to live. And the third part of their ordinance prohibits camping and overnight parking in the city parks. So initial violations trigger a fine, and multiple violations can result eventually in imprisonment. And I understand that no one in that city ever got as far as being imprisoned under their ordinances. So up until this point, the court had been following a case called Martin v. Boise, which was another Ninth Circuit Court of Appeals case, which held that the Eighth Amendment's cruel and unusual punishment clause bars cities from enforcing public camping ordinances like these against homeless individuals whenever the number of homeless individuals in a jurisdiction exceeds the number of practically available shelter beds, which was found not to be practically available because the shelters required folks to refrain from smoking, drinking alcohol, and required them to attend religious services. So they found that that was not practically available. Several individuals, 2 or 3 actually, who were actually living in their cars, which was also considered camping, filed a class action lawsuit on behalf of all homeless people living in Grants Pass, claiming that the city's ordinance against public camping violated the Eighth Amendment. Neither of these individuals were ever subject to an order barring them from city property or to criminal trespass charges because the city purposely took a light touch approach to provide law enforcement services to all members of the community while protecting the rights, dignity, and private property of the homeless. Officers were instructed that homelessness is not a crime, and they were encouraged to render aid and support to the homeless whenever possible. The district court, so the first level of court, entered what we call a Martin injunction under the Martin v. Boise case I mentioned earlier. So they entered an injunction prohibiting Grants Pass from enforcing its laws against homeless individuals in their city. So following the reasoning in that case, the court found that everyone without shelter in Grants Pass was involuntarily homeless because the city's total homeless population outnumbered its practically available shelter beds. And I assume there was one shelter in that city, but it required abstention from smoking and required everyone to attend religious services. So the district court found that those shelter beds were not available. So then it was appealed, and a divided panel of the Ninth Circuit, which is your western coast states, we're in the Seventh Circuit. A divided panel of the Ninth Circuit Court of Appeals then affirmed in part by granting the district court of affirming part of that injunction. Grants Pass then the city filed a petition for certiorari or review, asking the Supreme Court to reassess its holding in Martin. So then the court held that the enforcement of generally applicable laws regulating camping on public property does not constitute cruel and unusual punishment prohibited by the Eighth Amendment. That clause focuses on what method or kind of punishment a government may impose after a criminal conviction, not on the question of whether a government may criminalize particular behavior in the first place. So the definition of cruel and unusual punishment, the description of that comes to us from the Powell case, which describes cruel and unusual to mean calculated to superadd error, pain, or disgrace, and considered unusual because by the time of the Eighth Amendment's adoption, the punishments had fallen out of use. Following that reasoning, the Supreme Court said they could not say that the punishments under Grants Pass's ordinance were cruel or unusual. It imposed limited fines for first-time offenders, an order temporarily barring an individual from camping in a public park for repeat offenders, and a maximum sentence of 30 days in jail for anyone who engaged in multiple violations. Such punishments, they found, were not designed to add terror, pain, or disgrace, nor were they unusual because fines and jail terms are among the most usual modes for punishing criminal offenses throughout the country. If a law criminalized a status rather than a behavior, then it likely would offend the Eighth Amendment. So Grants Pass ordinance was found not to criminalize status, but to prohibit actions undertaken by any person regardless of their status. So they gave examples of vacationers, a kid that moves out of their home and sets up a tent, could be anybody passing through. So it applied to everybody, not just homeless individuals. Grants Pass had also appointed a homeless community liaison officer charged with ensuring that the homeless receive information about assistance programs and other resources available to them through the city and its local shelter, much as Matt Barnes has described and much like you've already been doing. So does anybody have any questions? That's my brief synopsis of the holding in Grants Pass. And we do not have an ordinance that bans camping on public property. So as Matt said, we've carefully weighed this as we've moved along, and there doesn't appear to be anything requiring us initially to take any action. And I think I also read that even in Grants Pass, they're taking a very slow approach and not amending or radically changing anything about their process at this point either.
Thank you for that. I know it was relevant, and it was something that's, we all have tried to keep an eye on pending its outcome. Alder Neal.
Thank you. Well, regarding no existing ordinance against, camping in a public park, we do have, posted that, parks close at a particular time, which means you're not supposed to be in the park. So what's the implication from that?
Well, correct. And so you would be in violation of that ordinance if you were in there. I suppose you could go in and set up a temporary tent and sleep there until the park closed, but then you'd be in violation of that ordinance if you remained there during the night.
Okay. Additional
other
questions for
questions?
Ann? Alder Gisselman.
Thank you. Well, I didn't know Grants Pass was going to come up this evening, but as part of the dissent from Justice Sotomayor, she concluded her dissent from the Grants Pass decision of the majority of the Supreme Court. She quotes, "I remain hopeful that our society will come together to address the complexities of the homelessness challenge facing the most vulnerable among us. That responsibility is shared by those vulnerable populations, the states and cities in which they reside, and every one of us. And then quoting Matthew Desmond from his book, Evicted, it is only after we begin to see a street as our street, a public park as our park, a school as our school, that we can become engaged citizens, dedicating our time and resources for worthwhile causes. And then she goes on to conclude, this court too has a role to play in faithfully enforcing the Constitution to prohibit punishing the very existence of those without shelter. I remain hopeful that someday in the near future, this court will play its role in safeguarding constitutional liberties for the most vulnerable among us. Because the court today abdicates that role, I respectfully dissent. Thank you.
Thank you. Thank you for sharing that. I mean, there's multiple sides of all of this, and so
Absolutely.
knowing that it was relevant and pending and that it had just resolved itself as we were scheduling this meeting, I figured it was important to include. So thank you, Ann, for that
Thank you.
update. Okay, next person that's up on the city side is Tracy Rieger. We'll bring up our community outreach coordinator. Tracy is out, as you know, in the streets doing this work on the daily. And every month, she reports to public health and safety, and she talks about successes and challenges. Sometimes she brings a success story with her to talk with us. Tonight, we held her report so that everyone can hear from her. So welcome, Tracy.
Thank you. Thank you for having me tonight. As I report every month to Public Health and Safety Committee, I go through the data that I receive from Catholic Charities, the women's community, Bridge Street Mission, our county jail, and then an estimate of those who might be living outside. Excuse me. So in June, our data suggests that there's approximately 183 unhoused individuals identified through those sources. So of course, that does not include individuals that are couch surfing or by some other definition of homeless. So it's just these 5 categories that we're looking at for this number. That equates to 80% of our unhoused seeking shelter and about 20% of our unhoused living outside. And of course, these numbers aren't exact, they're estimates. And I know that we have our point in time coming up in a couple of weeks where a team of us go out and we try to identify individuals in our community who are living outside or in vehicles, and we try to get resources to them and try to make them count as well. So that's coming up. In terms of Catholic Charities, they were at capacity only 7 nights for the month of June, which is great considering they weren't full the whole month, or they've only had 4 turnaways the month of June. So that to me was great. Typically in the summertime, we'll see our numbers decrease in shelter because there's individuals that prefer to be outside. And then, of course, we also have individuals that are not able to seek shelter for a variety of reasons. One of them being, they've received a strike and are not able to go to shelter. Another one may be mental health reasons. Another one may be AODA reasons. So there's a multitude of reasons why people might be sleeping outside. And I just want to make that very clear to this group, because it's not just about not having shelter space, adequate shelter space. So Catholic Charities capacity was at 91% for the month of June. And so, I think they're doing a great job in terms of getting as many people in that want to be there. And so that's what I can report on that. As far as my activity for the month of June, I did have 2 individuals get housed this past month. And I reached out to about 11 individuals besides that. So to date, I have housed 52 individuals since I started, and about 13 of them have entered back into homelessness. So that kind of brings me to the next part of what I'd like to talk about tonight, and I think it was the request of us to kind of identify what sort of gaps we might be seeing in our community related to the unhoused. And I'm speaking specifically to my work. And so I just want to share some of that with you tonight. So a recurring theme is that housing is the issue. Affordable housing is an issue for sure. But what I'm seeing, and I partnered with the Housing Authority for their Section 8 application process, and 56 individuals who identified as unhoused are in the process of receiving vouchers to get to get housing, which is fantastic. Some of those 56 will not be eligible for housing due to criminal records and some other eligibility things that the housing authority requires. But what I'm finding right now is that as I'm able to find landlords, which is the first barrier most of the time in helping these individuals, the second barrier and almost the largest barrier now is that we have landlords who are charging individuals double security deposits. And I know that in my absence, Chief Barnes had spoken to you in finance and in city council, and that it was approved that I could accept a grant money that I had written for through the United Way's Impact Grant to help these individuals get into housing for security deposits. You know, when someone receives a Section 8 voucher, it's almost like winning the lottery. Section 8 vouchers are great because they allow somebody an opportunity who doesn't have a very high income or no income at all. So if some of our unhoused members are receiving a Section 8 voucher and they don't have any income, the most that they would have to pay for housing is $50 a month. So when we look at trying to move the needle on homelessness and trying to get people into housing or into a different solution other than shelter or living in a car or outside, we look at things like, what can we do to get them into housing, and how can we navigate through that? And so one of the things, like I said, that I'm trying to work on right now is the security deposit thing. So I do appreciate your approval of me being able to accept that. Obviously, the stock of our affordable units is low. This is not a new concept. The other thing that I think is really important just to share here is that when somebody who is unhoused gets housed, you know, we're working on double security deposits, but we're also working in a space that has nothing. So they're going into an empty shell of an apartment. So I do work with resources such as St. Vincent de Paul, and I do have individuals who volunteer and give me furniture. But that is one of the things that one of the other barriers that I'm finding is it's difficult to find things for these individuals to put in their house so they can be successful when they're there. I think Chief Barnes alluded to this too, transitional housing. I honestly can't stress it enough. If I can tell you where the failures are in the help that I'm giving people, it is exactly what Chief Barnes said, which is getting somebody housed sometimes is the easiest part. Keeping them housed is the hardest part. I brought a lady last month who was my success story, and she, even though she's doing great, is still struggling with that transition out of homelessness and into her own space. So if we had an abundant transitional housing program in the city, that I think would help us tremendously. The last thing we want to do is get somebody into a year lease and then have them get evicted. It's just, it puts another barrier on their record to not being housed again. Ongoing case management. So in my opinion, there needs to be additional personnel working on this issue, whether that is volunteers doing mentorship or additional staff out on the streets doing this work. I think it's really important to identify that it can't be one person or two people or three people doing this, because the problem is bigger than that. The other thing that I noticed recently in the last few months is I'm seeing a lot of individuals that are coming out of incarceration. And so it would be awesome if we could do some more comprehensive discharge planning with not only prison systems, but mental health facilities, people that are in a 28-day program who are about to be released, and there is no housing option for them. So they get housed back onto the streets, and then they relapse. And so that doesn't make a whole lot of sense. So working on that would be great. And then just transportation, which has kind of always been an issue. I have individuals that want to work, but they don't have a way to get outside of the city limits of Wausau to get there. So that is what I can provide tonight. Do you have any questions?
Okay, and Tracy has the best firsthand knowledge, I mean, as far as our departments for what she's seeing out there. Does anyone have questions for Tracy? Oh, Alder Gisselman, go ahead.
Thank you. Can you tell me a little bit about the people that are not coming, for instance, to Catholic Charities? So obviously the census of homelessness people is steady, perhaps even growing, I'm not sure. But so where are they in the community, in parks, tents? Can you describe, I'm not sure if you're aware of that, but if you can describe that, a little bit of the sense of the homelessness that don't come to Catholic Charities, but yet are amongst us?
Sure. Well, I can't give you specific numbers on how many are doing what, but I can tell you that with the people that I have come in contact with that are not seeking shelter, it's due to some of the other reasons that I had mentioned earlier. Their mental health, they're not able to be in a congregate setting. Their alcohol and drug abuse issues. They want to be able to use and they can't. If they leave the shelter for the night, they can't go back. So those are two issues. And then, I don't want to speak negatively at all, but I will say that there has been some concerns that individuals have presented to me about safety. And I think you get that in any shelter. I'm not here to, single out any one shelter, but there are people that don't seek shelter because maybe something happened on the streets with another homeless individual and they don't feel safe going to shelter. So there's really a magnitude of reasons why people don't seek shelter, and those that aren't in shelter are finding either a friend's house to sleep at for the night. Maybe they are camping somewhere where they're deep in the woods, we can't really see them. I don't know if Chief Barnes or anyone else has more detailed information about number of encampments that we have dealt with, but from my perspective, that's what I'm hearing. You're welcome.
Okay. One other thing that I know we identified in our task force as creating a bit of a shift in the shelter model is that Salvation Army recently has shifted its model to serve families and not single individuals anymore. Do you find that is, it's not winter yet, but that will probably put significant pressure on the shelter systems that we have today, right? Do we have a storm brewing for the winter?
Well, I think it's yes and no. So what I can tell you is Salvation Army still reports to me their number of turnaways, and they're having less and less turnaways of single individuals. So I think that the message as a whole that is out about them just sheltering families is out there. So they're not seeing a lot of individuals even come to their doors that are single. Yes, I think that we're going to find once it gets colder that we're going to probably have inadequate shelter space just because Catholic Charities has capacity to only shelter so many people. And then where do the other people go? And I know that you're going to be asking Craig Vincent about Community on Call, which is an initiative to kind of help with that. But it only helps with that during certain conditions, right? So I don't have the answer as to what happens outside of that.
On normal days,
Right.
basically. That I think is just something that we should probably keep our eye on too, knowing that, as we have people out doing that street level outreach work, that, that could morph too as the season changes a little bit. Let's go, Alder Killian.
Thank you, Madam Chair. Tracy, you mentioned that individuals who have alcohol and drug problems oftentimes can't utilize the shelters. Has there been any effort in our community, or is there any effort to develop a wet shelter for people who have addictions?
I can't speak to that. I have not been included in any type of conversations related to that. I can, and I just want to clarify, if someone has been using or is intoxicated, they are not turned away from Catholic Charities. I just want to make that very clear. They are able to still go to Catholic Charities for shelter if they're able to take care of themselves and be safe. It is just that if while they're in shelter, they get the urge to use and want to leave, then they can't come back. So, but wet shelters, I have not been part of any conversations about that.
Okay, thank you.
You're welcome.
Thank you. I've not heard that in the task force either. Let's go Alder Henke and then Alder Watson. Or wait, who put their light on first? Okay, Sarah, and then Chad, sorry.
So I had a question about the demographics. So have you been able to collect demographic information like gender, age, length of homelessness, other comorbidities or whatever it is? Yeah.
Yeah. So as I meet with new clients, I have a pretty robust intake form that I complete with them. I just worked with some command staff at the police department, and we kind of revamped that a little bit to get even more information. So I'm starting to use that. But yes, I do collect all of the information that you're asking about. I do hit really hard on the medical and mental health side of things too, to just make sure I'm being looking at it at a holistic approach, so I can help with resources that they might need. So, yeah,
So you sort of mentioned this is unduplicated, right? Is there any system that has been sort of talked about, or is there information exchanged between all of these providers so that You know, because maybe having like clear data, we can maybe direct things a little better.
Right, so, you know, unfortunately, there are some systems in place that don't allow for full transparency of information sharing. So I would also consider that as maybe one of our barriers. I do think that it would be really important and impactful in terms of action items for the work to be done if we could get a more transparent picture about what our numbers actually are, because I think it's hard to develop programs and develop strategies without knowing what the actual number we're looking at is. So Robert Malbrut was here a couple months ago and did a presentation, and he suggested also that we have a, you know, database, a one-stop shop database that lists all of the unhoused in our community. So, you know, that is something that I know came up as a suggestion to our community to try to maybe take on.
Thank you.
Welcome.
Thank you for that. Chad?
Thank you. Let me turn my button off. I'm on the CDA board, and I know they all had a lot of great things to say about this housing voucher program that went through for the first time that ranked homelessness, gave that a higher priority. And everyone said, Tracy, without Tracy, that probably wouldn't have worked, just communicating people. And then I haven't been on public health and safety in a while, so I just went back and looked at some numbers. December of 2022, you said it says 220 people were unhoused. April, it was 202. March of this year, it was 238. This is the first report I've seen in a while, and I saw 183. And is there a changing in the way you're reporting that, or is this fruits of your labor, you think?
So
or-
there's a couple of reasons why the numbers look a little different right now. Number one, we pulled Salvation Army out of the mix. So they were reporting out at least an additional 35 people also, give or take. The other thing, and I know Craig is going to be coming up here to speak about his program, but I know that they halted additional intake until the move is completed, and he'll talk more about that. So there is a reason why some of these numbers are shifted the way they have. Yeah.
Okay, thank you.
But some of it is the result of her work, so
That's what I thought it was.
she does good work. Mayor?
Well, thank you. Just to piggyback on what Alder Watson was asking about demographics, you're listing 12 new guests who were identified as new, having never been served before. Do we have a sense of who they are? Are they new to the homeless scene, or are they new to the city, or a combination, or don't we know?
So this is information reported from Catholic Charities, so I'm going to defer that question to them to see if they can answer that more, more transparently. I just get this information from them, and there's no telling whether I've even been able to connect with any of the 12 that are listed as new here. So I can't answer that question, honestly. Sorry.
Well, and I guess just as an aside, talk to us a little bit about how you connect with people. I mean, obviously, your referred agencies refer people to you, our police department refers people to you, but you also hold regular office hours within a number of agencies to connect with people that, like at the library and things, right? So
I do.
talk to us a little bit about like where people find you during the week.
Sure. So I do want to say, publicly that the two officers that have been designated to the downtown space have really been magnificent in terms of giving people my information and them contacting me. It's been great to have that partnership with them because they'll even call me when they're out with somebody, and if I'm available, I've gone to them directly on the spot. So that partnership with our downtown officers is a really great resource that we didn't have before, obviously, so that's good. I do meet with clients on Tuesday mornings at the library. I meet with clients at the Community Partners Campus on Wednesday afternoons. And then anytime in between all of that, I offer them the opportunity to meet me wherever they're comfortable. So whether that's at the police department, I've met people at the coffee shop downtown, wherever they want to meet me is where I'll meet them.
Okay. I think that's super helpful as well. Anybody else have questions for Tracy about her current work? Okay. Thank you so much
you.
for that report. The last city function that we have to offer you a short comment is Wausau Fire Department in Public Health and Safety. They had just talked about the rollout of the community paramedic program, and one of the upsides of that program when we created it was that it does make an impact also on this population. So I'll invite up Deputy Chief Plus if he'd like to come and just give us a quick update about the program status and about the function of that once it gets rolling.
Sure.
Welcome.
Thank you. So the community care paramedic job posting has just been posted this month and will close here shortly. We hope to bring that community care paramedic on board here mid-August. So the community care paramedic program is going to focus on two areas, falls prevention among our vulnerable individuals and reducing the uses of 911 services for non-emergent medical needs that are identified by high utilizers of the 911 system. The outcome and process measures will include keeping track and measuring the number and percent of 911 calls diverted from the emergency department, the percent of patients reporting an improved quality of life, the number of patients and the percentage of patients who have established a relationship with behavioral health services and case management, and the number and percent of patients with a documented care plan, number of patients readmitted to the hospital within 30 days of discharge, and the number and percent of medications issued documented in patients referred to primary care providers. The process measures will also focus on community paramedicine and will have process measures that are related to the program. And those processes would include the number of patients enrolled in the program, patients graduated from the program, number of referrals to the program from the emergency department, number of referrals from the police department's community outreach, and the number of patients receiving referrals to primary care and social services, and the number of high utilizers post 6 months. And those high utilizers are identified by anyone who calls 911 more than 4 times in 1 month or 10 times in 6 months. So, like I mentioned, the community care paramedic position hasn't been filled yet. We hope to have that community care paramedic on board mid-August. And this initiative aligns with the city's commitment to promoting health, public health, and well-being. And the implementation of this program and process measures will help track the program's effectiveness.
Thank you. And when we talked about this program originally and why I think it's relevant is that so often we'll have people that either come to our area seeking medical care, or we have individuals who receive medical care in our area, and then post-discharge they don't necessarily have somewhere to go. They may be released with prescriptions and all kinds of instructions, but then the follow-up and the following through on following those instructions, I think, is where we saw this program perhaps being key to make sure that that person is not readmitted just based on their circumstances. And do you still see that as?
Our paramedics are treating and transporting the high utilizers each month. Will report that a lot of times it's just not understanding their medications, not getting their prescriptions filled, or simply not making their follow-up appointments with their primary care. So this community care paramedic is going to be trusted to meet with this person, sometimes in their home or with unhoused, and make sure that they are able to follow up and that they're actually making those appointments, that they're understanding their medications, that they're actually getting their prescriptions filled.
And you would see some workable connection between that community care paramedic and Tracy Rieger as well, as far as referrals and things.
For sure. Tracy mentioned that the healthcare and the behavioral health services. That community care paramedic can receive that referral from Tracy then and make those connections and make sure that those individuals are getting the health care that they need.
Okay, I think that's helpful. I mean, it's helpful for our senior population, but I think there's also an impact to be had for this population as well, a positive impact. And important to recognize that this program was funded, partner funded by healthcare systems and I believe foundations as well. So
Correct.
The community actually is responding to help us with this without attaching it to the levy. So that's super helpful for us. Anybody have questions for Deputy Chief Ployce at all? If not, we'll place his report on file as well. Thank you so much for that.
Thank you.
So those are the city agencies, the committee, the city departments, and the city administration in terms of the work that they have in progress. The second facet of our analysis tonight is work happening to impact homelessness by Marathon County agencies. I've invited County Administrator Lance Leonard to join us this evening and just give us a little synopsis of agencies and programs within the county that are already impacting this issue that we may not be aware of. And I think that there's also then this may bring us down the line some opportunity for some, dialogue and partnership on other things. But I wanted him to just recap for us, things that he's seeing within their agencies that we may need to be aware of. Welcome.
Thank you very much for the invitation, President Rasmussen, members of the City Council. So in speaking with President Rasmussen, I was asked to kind of keep it at a 30,000-foot level. I know you're much more familiar with all the wonderful work that your city departments are doing. I'll try to give you a relatively quick snapshot of some of the things that we're doing at the county. I'm going to organize my comments around three things. First, how I think the county is trying to be an active participant in the community discussions that President Rasmussen referenced. Number two is how we partner with nonprofit strategic partners. And three, some direct service provision that we do through our departments. Now, I'll start with the latter and work my way up to the former. In terms of county department specific work for individuals that are struggling with housing stability or those that are actively lacking housing, I'll start with our social services departments, just highlighting two key programs or services that they offer. The first is the Family Keys program. It's a pilot program in the state of Wisconsin. We developed a proposal and were selected as one of 3 counties in the state to move forward with that. Essentially, it's a program aimed at ensuring that families where housing, stable, safe housing is the primary barrier that is causing concern relative to removing children from their home of their parents, that we actually have a program where we put those individuals, those families, into safe and stable housing with increased case management and monitoring. That case management is provided through a contract with North Central Community Action Program that I'll talk about later. That program has been going very well. So that's a program that we're quite proud of. Second, at social services that people probably aren't aware of, if an individual is an unhoused individual, we actually have a program to ensure that they can sign up and have a mail delivery, a set place where their mail will be delivered. As you would imagine, there are a lot of things, whether they're government benefits or other items that individuals would have a significant need to ensure that they have access to those. We deliver that through social services. As alluded to by Chief Barnes and others, our justice system does a couple of innovative things with respect to providing care to individuals with housing instability. I won't belabor the point relative to the district attorney's office. Through our deflection and diversion programs, Chief Barnes covered that, as well as Tracy. We are applying, as they indicated, for those enhanced funds. But another area where we directly provide housing resources is through our treatment court programs. We've had 2 adult treatment courts for some time. Individuals, as Tracy alluded to, one of the challenges is individuals go through inpatient treatment and then they discharge from that treatment or an institution where they receive that treatment. And if we put them back in the same environment, the outcomes are oftentimes not as good as we'd hope. So we actually provide housing through that program. We have 8 beds that we contract with private landlords through some duplexes to make available to ensure sobriety following treatment or institutional discharge. Another department that you're probably familiar with, North Central Healthcare, is essentially a county department of 3 counties. We have a sober housing program through North Central Healthcare that is funded in large part through county levy allocations. That is Hope House. It's a discretionary program not mandated by the state of Wisconsin, but the county, along with outside revenues from North Central, provides that program. North Central also recently hired 2 individual staff to do outreach, as was alluded to, very similar in terms of some of the work that our deflection staff do within the DA's office. This outreach and peer support work through North Central Healthcare is relative to opioid-related substance abuse treatment. So it's kind of a limited scope, but that work also is going to have a specific component aimed at engaging the unhoused population or those with housing instability. We have inpatient programs for treatment, substance abuse treatment. We also have inpatient mental health treatment that is provided at the North Central campus, as well as a battery of outpatient treatment programs. Other direct service provision through the county. I don't know if anyone is familiar with the Wisconsin Help for Homeowners program, but our county was specifically active through our treasurer's office while that was in place through the state of Wisconsin, really aimed at engaging homeowners who were struggling to remain in their homes during the pandemic, to inform them of that potential benefit. Marathon County also is a member of the Community Development Block Grant. It's a multi-county program that allows access to funds for individual homeowners and landlords to make sure that they're able to provide a safe environment and people can access funds. The county, I believe, along with the city and other municipalities, funded directly a study by North Central Wisconsin Regional Planning, and I know you're all familiar with the results of that study. And then lastly, in terms of direct county department work, I just highlight that our library has a long-standing working relationship with the Wausau Police Department and the city of Wausau in general, certainly to allow a safe place for individuals to engage with the individuals who are unhoused for that consultation and active engagement relative to finding a path toward housing stability. I would say that the library just recently added a position through a contract with a private security firm to ensure that, we can address some of the challenging behaviors. The City of Wausau Police Department has been truly exceedingly helpful with the library when we do have those issues. And I know should we have a serious issue, we'll still continue to rely upon the police department. But I think that, as the chief said, sometimes mere presence of an authority figure and a security personnel will hopefully offer that is really important. In terms of partnership with strategic nonprofit partners, I would just want to highlight a couple. As was alluded to before by Tracy, sometimes what we find is that individuals, once they have some instability with respect to housing or they have an eviction on their record, that makes the procurement of long-term stable housing exceedingly difficult. The county has funded for a number of years now a program through Wisconsin Judicare where we allow for mediation services for Judicare to come into our courts and mediate disputes between landlords and tenants, with the whole aim to be that we avoid that eviction action. Really, it's not only for the landlord and tenant's benefit. The landlord essentially wants their rent paid. The tenant certainly doesn't want an eviction on their record, but also selfishly from the county's perspective, those things slow down the court process. And as was alluded to by the chief, oftentimes we have other matters that are more pressing. So we've funded that for a number of years. It really is better thought of as a housing stability program. The women's community certainly provides housing, temporary housing for individuals that are impacted by domestic violence, sexual assault, stalking, and human trafficking. I know you're all familiar with that organization. The county has for longer than I can probably think off the top of my head that they've supported the work of the women's community through an annual allocation. I referenced previously North Central Community Action Program. They do great work relative to housing case management, which has been alluded to previously, is one of those big barriers. We have a lot of programs that will actively help people address kind of some of the underlying issues that can result in housing instability or being unhoused, but it's that active ongoing case management that we've found really helpful in our Family Keys program to help people understand what it takes to stay in housing. North Central CAP delivers that for Family Keys. We also, the county, through the county board annual budget process, funds North Central CAP with an annual allocation as well. Some of the programs that North Central CAP does for county programs, as Tracy alluded to, it's really important. And as I said before, when individuals discharge from both institutions and treatment programs, that they have someone to really work with them to try to have a safe and stable housing plan. Part of our annual allocation to North Central CAP requires that they work with North Central Healthcare through their community treatment programs and their inpatient programs to provide for that pathway to stable housing. Similarly, we have a requirement through North Central CAP, through that allocation, for them to do very similar things with social services and with the Marathon County Jail and probation and parole, so that people that are leaving a prison institution or our local jail can avail themselves of those services. I previously mentioned the Community Development Block Grant Regional Consortium. The last thing I'll mention relative to strategic partnerships, I think we've seen the value, as Chief Barnes referenced, to trying to seek out funding opportunities, outside funding opportunities. The county has continued to do that. One of the areas we saw success was through the block grant program. Certainly the city gets a block grant through the community development program. The county applied for an additional allocation through the pandemic and received $500,000 to assist homeowners and renters with housing instability issues outside the city of Wausau, because of course you get a direct allocation. That program, however, did end with the pandemic. So, and then lastly, I just want to highlight those active participation in community discussions that are ongoing. If you weren't aware, Marathon County is currently funding a continuum of care gap analysis through our health department. They're overseeing that. The idea being trying to look at our continuum of care for individuals that have opioid-related substance abuse problems. Now, it is limited because of the funding stream. It was through the opioid settlement dollars that the counties received to pursue that analysis. However, I think it's important to note that what we learn from that analysis is not going to be limited to opioid-related issues. That same logic will apply elsewhere, but that gap analysis, I fully anticipate that housing will be one of those areas where we see a gap, as certainly others that have appeared before you have already referenced. I have the honor to sit as the county's representative with President Rasmussen and Mayor Dinny on the United Way Housing and Homelessness Coalition, where again, we've discussed these issues and where our gaps are, what our challenges are. We've made staff from the health department available to help facilitate some of those conversations as necessary. I also think, as was alluded to by interim Director Pfeifrick, relative to housing stock discussions, the county has been much more active reaching out to municipalities, including the city of Wausau, relative to what opportunities exist for some of the parcels that the county owns. So I'll give you a couple of kind of categories where that's happened. One is county-owned parcels. A couple of examples would be a couple of parking lots, which, as Mr. Pfeifrick referenced, you're looking for that infill housing. We've also worked with Habitat for Humanity. The county recently sold a parcel for infill housing in the city of Wausau for development. We've also looked at how we can do a better job on our tax delinquent, non-occupied housing. So that has been a work in progress, and I'm happy to report that we are seeing progress. We have a court hearing scheduled for quite a number of parcels here, hopefully to, again, find a way to get those parcels not only back on the tax rolls, but also available for individuals looking for housing. And then lastly, which I've had a number of conversations with various city staff, and I do think this is a real opportunity for ongoing discussions relative to improving the availability for affordable housing, is redevelopment of some county facilities. As you may be aware, Marathon County has really been trying to be forward-thinking in how we can consolidate our footprint through some strategic capital projects, and we will be having all the departments that are currently located on River Drive in the city of Wausau off of River Drive sometime in early next year. Similarly, we're hoping to have all of the current occupants out of our Thomas Street facility. Social Services was in that building. They're now, they've been relocated to our Lakeview campus. We have one additional small department we need to find a home for, but that Thomas Street parcel then would be available for redevelopment, and I think there's certainly an appetite for conversation with the city of Wausau on how to do that effectively, consistent with the city's plans. I think the one thing I want to leave you with, if nothing else, is that the county board, through its committees, has, from my perspective, expressed a desire to be part of that conversation, as President Rasmussen indicated, a desire to be part of the solution to these challenges. I think everybody from my staff, certainly myself, recognize that there's not going to be one answer, and this isn't any one department or one entity, one municipality challenge. We're going to need to pull in the same direction on this, and I think the county board has the leadership in place. They've made clear that they wish to do that. And then lastly, I think just going back to the service on the United Way Housing and Homelessness Coalition, the willingness is there to engage in that educational, that outreach to figure out what are those innovative practices going on around the country. As Chief Barnes referenced what's happening in Salt Lake, I know in all the conferences that I've recently attended, I've made it a practice to try to attend some programs related to housing and the unhoused, and how counties around the country are looking to be part of the solution. So I know that was a lot, perhaps lower than 30,000 square feet or 30,000 feet, but happy to take any questions.
No, it's all good stuff. Thank you so much for that. I guess the one thing I've observed serving with Administrator Leonard on the Housing Task Force that the United Way is now running, that task force really gets results. I mean, what we've gotten in terms of a list of achievements that have come from getting the right people around a right table, getting decision makers around a table that can take stuff and push it forward really has been pivotal for that task force. And one discussion that Mayor Denny and I have had from the beginning was that sometimes a task force, to achieve a task, to study something and figure out where opportunity lies, really can make a difference. I just, at the end of last term, spent some time serving on the county's tax increment district financing task force, along with a number of county board members. That was time well spent. We had some really good conversations. We learned a lot, and we walked out with a totally different understanding of one another and of the subject matter. And that said, you know, if there is an opportunity at some point going forward, and this is something I know that Mayor Denny wants to work with the county on, is if there's an opportunity for us to put together some type of joint task force to explore specific things more in depth, that's something too that we want to be a part of. It's inspiring to know that the board wants to be a part of these discussions as well. You know, I think it's easy sometimes for us to assume what the sentiment is in other units of government's chambers, but we're not always right about that. And so that's why I wanted County Administrator Leonard to come and talk to us this evening about what's actually happening down the street, because I think we can make some inaccurate assumptions if we don't hear from them. So I'm so glad that you came. Alder Larson.
Thank you, Madam Chair. Mr. Leonard, I've said on a few times, what's going on with the old UW dorms? I mean, why can't we use that as a transitional center, or why can't we use that as for getting our homeless people off the streets and giving them a warm place in the wintertime? I'm hearing there's dollars involved and stuff, and why can't we use that facility? And if not, why can't we use that facility? What plans are there for that facility? Thank you.
Sure, great question. I think the short explanation as to why it's not suitable for transitional housing or any type of housing right now is it's unsafe. That building needs significant, it's not suitable, I'll say it that way. It's not suitable for individuals to be, whether the individuals are unhoused or they were students. That was the reason it got closed down, is because it wasn't suitable for students. So could it be rehabilitated? I think the short answer to that is yes. But that needs to be a strategic decision made not only at the county board, but also with the university in terms of what the best use of that space is. I think there are other spaces that the county owns that if there's a desire for expanding housing stock, as I alluded to before, there's a number of other facilities, whether they're kind of greenfield sites in terms of parking lots for infill housing. I know that's not specific to your question. Those might be lower hanging fruit, for lack of a better turn of phrase. In terms of what the future of that particular parcel is, it is part of the West Side Master Plan that the county adopted previously. My thought is that in the next several years, there's likely to be a request, a capital improvement request to raise that building, unless there's significant groundswell to change the opinion that it's a good site for some type of housing. It's also, the age of that construction is not something that makes it readily available to or amenable, I should say, to reconstruction. That thing is built with a whole lot of concrete. And the ceilings are low, so it just makes kind of that transition to individual housing. We had a number of contractors walk through it a number of years ago and in fact put out an RFP to redevelop that parcel into housing, and ultimately no one responded.
Okay, thank you for that.
Thank you.
Does anyone else have questions for the county administrator? Alder Gisselman, go ahead.
Thank you. You were speaking a little bit. Thank you. You were speaking a little bit before about as I noted, the treatment court. Is that how you referred to that?
Correct. We have we've had treatment courts in our justice system, yes.
And I noted 8 beds. Is that enough, really? Or how the numbers coming off of that? Doesn't sound, just sort of a sense of the population needing that type of transition, needed that kind of a care.
So my lack of depth was probably a function of the 30,000 foot level. So treatment courts, for those that are not familiar, is a specific model in the justice system, high intensity, high touch program where you are essentially taking individuals who are high risk, high need, and rather than having them institutionalized, you're providing community-based treatment. So if you think about an individual who's facing significant charges in our justice system, with all the things that come from that individual being high risk, high need, at treatment court, best practice is for any individual treatment court to have no more than 25 people in it. So I think to your underlying point of don't we have more people in our justice system that need housing? The answer is yes. However, our treatment court program, we can only handle effectively through the treatment court model a limited number of individuals. And at any given point, the treatment court model is about 18 months long if someone is really progressing well. When they start, we want them, if they don't have safe, stable, sober housing, we want to have housing available. But the idea is not that we house them for 18 months. It's that we address our needs, get them on the pathway to treatment, and then we help to try to find them their own safe and stable housing, similar to what our Family Keys program is. So the idea is that at any given point in that program, we might have a population of 20 to 25 individuals. Our hope is that 8 beds is enough. I will tell you it's not. We're oftentimes having those housing conversations just like all of you are having them with respect to the information you hear from Tracy and Chief Barnes. But that's the reason why when I talk about treatment courts that we've only procured those 8 units. I will say I've had a number of conversations during my tenure, first as the deputy administrator and then now as administrator with city staff on, we'd love to partner on housing for our treatment court participants with the city. All the challenges that Tracy referenced that individuals have with landlords and some of those things, if you were to express or assume that the experience of the county as a landlord with those landlords, or a tenant rather, with those landlords would be better, unfortunately you're wrong. We have a lot of the same struggles trying to have that consistent, safe, stable place. So I hope that answers your question.
Thank you. Needed just a little background. Thank you.
Yeah.
Sure, thank you for that. Chad?
Thank you. I just want to thank Administrator Leonard for showing up, and then for looking at county tax properties. I think that's a new thing that we're trying that I see a lot of advantages to, and any discounts the city can get through those purchases would be much welcome.
You can talk to Ann Jacobson. She can give you another Supreme Court case overview of Hennepin County case and that came down a while ago that limits some of what you're talking about.
Okay.
But
And then-
the sentiment is well received. I understand.
Yes.
And
yes.
then any case managers that you can help us get hired, at North Central or through the county. Like I find I think that's the spot that could be helpful. Thank you.
Yep, absolutely.
Okay. Well, I think that what we have, at least through our analysis, is some food for further discussion, and I think that's certainly conversations that going forward we'll have before we get to phase 2 of this process and see what's possible if we all work together. So thank you for coming.
No, thank you very much for the invite. Have a great rest of your meeting.
Thank you. Okay, and so phase 3 of this tonight is a snapshot of work to impact homelessness specific to shelter operations by local agencies. And so we have 2 agencies that we've invited tonight on the shelter side. The first one being Catholic Charities. We have Nathan and Roberto with us tonight from Catholic Charities. They're operating the night shelter 12 months of the year, 365 days a year. They're operating also our day center for us, and so I thought it was a good chance to invite them to talk about, now we've got a little time under our belts, how that's going in terms of successes and some challenges that they've been seeing in operating our shelters. So welcome, Nathan.
Thank you. Good evening. I'm joined by our Executive Director, Roberto Parteru, who's based in La Crosse, and we're very pleased to provide an update for the council this evening. My update will focus on the 2 community programs Catholic Charities of the Diocese of La Crosse runs in partnership with the City of Wausau. We're very grateful for the work that we're able to do together in these initiatives. Catholic Charities is committed to improving the lives of the vulnerable in our community through a series of holistic program offerings, including the Good Shepherd Shelter and the Day Center. In addition, we provide adoption services, a transitional housing program called Beyond Shelter, St. Lawrence services, and phone consultations through our local office here in Wausau. Our goal is to create a community where everyone has access to the resources they need to achieve stability and self-sufficiency. We believe in the inherent dignity of every individual and strive to provide compassionate service that empowers people to overcome their challenges and achieve their own goals. Our philosophy centers on providing transformational services that not only address immediate needs and alleviate suffering, but also foster long-term growth, strengthening individuals and families within our community. We recognize that there is a continuum of needs, the most basic of which begins with food and shelter. For those in our community who experience a lack in these essential needs, we seek to provide a foundation for them to build upon through our emergency shelter services. So to start with, the Good Shepherd Shelter operates year-round, providing safe overnight accommodation for up to 30 individuals nightly. We offer shelter guests a warm dinner, light breakfast, laundry facilities, showers, clothing, essential items, as they're made available to us through donations, and referrals to housing and other community services. To provide you a brief snapshot in terms of service data, in 2023, we provided a total of 9,697 individual shelter stays for 297 individuals. Our volunteers logged 8,522 hours in 23. This year, through June, we provided a total of 5,394 individual shelter stays for 297 individuals. I'm sorry, strike that. That's for 23. So within the first 6 months of this year, it was 5,394 individual shelter stays. That's a 6.5% increase over the previous 6 months and a 16% increase over the same period in 2023. Through the first half of 2024, we served 153 unique individual guests. 83 of those guests, or 64% of those, were new to the shelter, meaning we had not seen those individuals before. Year to date, our volunteers have logged 4,541 hours, and last year our staff and volunteers served approximately 19,394 meals, dinners and breakfasts combined. The majority of the food that we serve is donated by our community. Shelters deliver several benefits to members of our homeless population and the broader communities in which they operate. First, prevention and risk avoidance. Our shelter prevents the immediate risk of exposure to harsh weather conditions, violence, and health issues that come with sleeping on the streets. Cost savings. Homeless shelters play a crucial role in generating substantial cost savings for the city. And I might add the county as well, of course. The cost to the city of a single homeless individual can be in the range of $50,000 to $250,000, as estimated by a consultant at Catholic Charities from La Crosse consulted with. This covers emergency room visits, police interactions, jail time, court proceedings, etc. Our shelter reduces costs for emergency services, healthcare, law enforcement. It is more cost-effective to provide shelter than to cover the cost of hospital visits, police interventions, and other emergency services in a crisis situation. By reducing emergency service utilization, decreasing interactions with law enforcement, offsetting healthcare costs, and promoting employment and job placement, shelters and our community partners contribute not only to individual well-being, but also to the economic vitality of our city. Safety and health. We provide a safe environment to help reduce the risk of injury, illness, and death among the homeless population. Compassion and human dignity. We offer a compassionate response to homelessness, affirming the dignity and worth of every individual that we serve. And finally, community building and personal development. Providing community members with opportunities to contribute to strengthening our community, practice charity, develop empathy, and cultivate other valuable life skills. Again, notice the volunteer hours that were logged this year. So we couldn't keep our shelter open if it weren't for the volunteers. And in fact, in past years, they ran the shelter entirely by themselves. So it's only in recent years that we've been able to hire full-time staff and part-time staff to provide a real foundation to ensure continuity for the shelter. But we still rely very heavily on volunteers and donors. So we're currently in the process of evaluating areas around the city for possible relocation of our offices and shelters. We've learned a tremendous amount during our time at Community Partners Campus, and we're extremely grateful for the opportunity to be a part of that partnership. We've simply outgrown our current space, and in order to provide the level of service needed, and in light of our current socioeconomic challenges, we're seeking a new location to meet the needs of our community. If you don't mind just dropping down the stats there. So these two charts give you a snapshot of the guest attendance and turnaways. And the second chart there down below shows you the Good Shepherd Shelter Day Center attendance. A little difficult to read in this lighting with the screen there, but in the top you can see the overall, in the orange, that's your number of shelter stays per night during this period of time. We're looking at 2024. And then in blue, you can see the turnaways. Down below, you can see the growing trend in the attendance of the day center. So again, we'll talk a little bit about the day center. We do see that as a critical service that the city is able to provide in partnership with Catholic Charities. I was tracking the male to female ratio there. It tends to average consistently around 25 to 30% within the shelter environment. Again, this is a congregate shelter, so everyone is in a small space together, which of course has certain inherent challenges, but this is a crisis or emergency shelter setting. So for the day center, we're operating Monday through Friday from 9 a.m. to noon, and then 1 to 5 p.m. The day center offers a safe, stable, and structured environment where guests can engage in community activities, consult with knowledgeable staff regarding community services, conduct housing and job searches, complete applications, receive assistance with paperwork, take care of basic hygiene needs, connect with local partner agencies, and receive housing, counseling, also connecting with mental health support, scheduling on-site dental care, and just basically enjoying a safe community space. We provide some entertainment as well. In terms of service highlights, we have partnered with agencies like CW Solutions, who've provided mental health, employment training, food share assistance, and St. Lawrence Services, our in-house financial assistance and housing case management service. We have a case manager full-time on staff to interact with our guests, and they have open office hours on Mondays, as well as our Wausau Community Outreach Specialist, Tracy Rieger, who has office hours every Wednesday, and she's able to provide ID, recovery, housing, case management work, and so much more. And then North Central Healthcare, we're in discussions with them about providing peer counseling support on site. And as mentioned, we have a monthly dental hygienist who comes in and provides dental care as well. And if the guest has insurance, there's no cost to them, or they can pay a nominal fee if they're uninsured. And again, these are basic partnerships. So we're experimenting in terms of what will have the highest impact in terms of the quality of outcomes for our guests. So there's no financial relationship here with these partners. We invite partners to come in and utilize a space where we've established a trusted relationship with our guests so we can provide that warm handoff and hopefully contribute to their achieving their goals more effectively. In terms of future planning, we're looking at ways to help our guests with job readiness. Again, I mentioned the peer group counseling. Community building is another important component to this, providing a safe place where they can simply be in community with one another. Homeless advisory committees, in-house case management. I would love to have the opportunity to bring in part-time staff to provide that more consistent, in-depth relationship in terms of a case management, maybe being able to work more closely with Tracy and mirror some of the work that she's doing and provide assistance there. In terms of service data, we're simply tracking attendance right now. We have served year-to-date 2024 over 1,900 guest stays. In conclusion, looking at the community impact of a day center, the day center serves as a hub of activity and support, addressing the immediate needs of guests and connecting them with long-term solutions. We offer a safe, structured environment for guests to work toward their individual goals, connect with services, and take care of basic hygiene needs. By fostering a sense of community and providing tailored support, we help individuals transition from crisis to stability. Looking again at the importance of day centers, more broadly speaking, prevention and risk avoidance, a day center provides a safe, structured space during daytime hours for individuals facing homelessness, reducing the risk of victimization and exposure to harmful environments. Cost savings by offering centralized services and referrals. The day center reduces the need for emergency services and streamlines access to community resources. We offer a stable environment where individuals can access health services, reducing the incidence of untreated illness and promoting overall well-being. And then finally, compassion and human dignity. We provide a respectful and supportive environment where individuals are treated with dignity, fostering a sense of community and belonging. By offering an oasis in an otherwise chaotic living environment, we can give members of the homeless community the time to focus on planning and goal setting. We develop a trusted relationship with our guests, which enable us to serve them more effectively, assisting them in the achievement of their goals. Thank you. I'll take any questions you may have this morning.
Thank you for that. Glad to see that, numbers are up to the extent that they are. I know that as the day center began, and you had taken that over from our initial launch that was originally managed by Open Door. The numbers, as you were staffing up and getting the program off the ground, were started out low. But as you were able to staff up, it looks like those census numbers are increasing a little bit. It's nice to see on the chart there numbers like 30 and 36. What I would say is, have you experienced any of the same, from folks that are coming to the day center, any of the same safety concerns that we heard about from Open Door? I mean, the management over at Open Door, one of the things they had mentioned to us was that they were dealing with two specific populations. One population at the center that was legitimately trying to get on a path to a better place, and another group that was content to prey upon them and in terms of, whether it was theft or whether it was the offering of things that they were trying to not use anymore and things like that. And so some were visitors. They weren't all, attending the center, but, they were trying to gain access to the center. And it was making the path forward difficult for some of those who were really serious about recovery. And that was at the other location as well. Have you seen any of the same types of challenges as you've been trying to launch and maintain the day center with your staff?
Well, we'd certainly be serving the same population of individuals. The question is, what are the behaviors they're exhibiting? And I'd say within our environment, at least, everyone has to abide by the same set of rules and guidelines. And so those are fairly strictly enforced. The day center is run separately from the night shelter. So if you receive a strike at the day center, it's the same policy. So you can have a series of 10-day strikes that would lead to a 30-day strike. And then you could potentially be banned, from the day center as well.
Sure.
So those are the policies we have in place. So guests can choose to follow the rules or not. We welcome everyone, but they're all expected to abide by the same level of
Well, and I think that
policies.
makes sense, because the goal is to obviously have people feel safe when they're there.
Right.
And not feel that they, shouldn't be or didn't want to be there. So, I mean, that always is my concern, is to create an environment where people are comfortable taking the help that's there. So if you're able to address that, and hopefully are cultivating a robust relationship with our police department as well, so that, when help is needed, if walkthroughs are needed, whatever that looks like, that we're working together to make sure that that's a safe place for people that are vulnerable. The other thing I would like you to talk to a little bit is programming. I know that you're trying to ramp up programming, to get people on that path. Obviously, you're providing a facility where they can network with the services that they need. Talk about the other program, because you mentioned job readiness, job readiness, rent readiness, things like that. So, I mean, in a typical day, talk to us a little bit about those offerings.
I think this is a key area of growth opportunity within the program. And part of that is staffing dependent. So one of the key challenges that we face now is sustainable funding. So given the current structure, the grant, we'll be working with the city to talk about the guidelines and whether or not, we can extend funding, for the program. At this point, though, I have a full-time individual within the day center, who's working 40 hours a week. If they can provide structure to that program, then we rely on the partner agencies to come in. So we've been experimenting with different partners throughout the course of this year, and observing the level of success. Is it something that really meets the needs of our guests at this point in their journey, or do we need to reach out and partner with other agencies? So that's really where we are. I'm looking for what's going to be the highest impact type of service, given the staffing and, frankly, the space constraints that we have. Because, if you've been down to the shelter, I would welcome any of the council members to please come and visit, reach out to me. I'd be happy to give you a tour. Essentially, you walk in, we have a dining room, and then we have a sleeping room. So imagine during the day that converts into a dining room and community space, and that is also an area where partner agencies can meet with our guests. But then we convert the sleeping area into a quiet room.
Sure.
But we still have a lot of people who just need to sleep. And
Right.
so we try to be flexible and really meet the needs. And we're looking at the community that we're serving right now. And I've been doing surveys, and one of the top most requested services is simply having a place to sleep.
Sure.
So when you're looking at that basic of a need that needs to be addressed, we really do need more space so we can responsibly provision the services and allocate space accordingly.
Sure, and I know that the mayor has recently toured both centers. That was something I was hoping that you would offer up to council members if they'd like to seek those tours or schedule them individually. It's easier to schedule them individually than as a group. If we take a group tour, we do have to post an open meetings agenda. We can certainly do that if we want to tour as a group, but I also think that it's a little bit less intimidating and invasive if we go one-on-one, because when the shelters are operating, people with needs are there, and they don't necessarily want a group of us coming through to, watch them and watching them receive services. So I think if we were to do that low-key and schedule those individually, that would be helpful to the folks that are there. We did through our funding model, and I guess, when we talked about programming, what I'm hearing you say is it's something that you would like a way more robust amount of, but at this point, between staffing and resources, it's not as robust as you would maybe want it to be. In terms of the funding model, just to get the thing stood up for 2 years and get it running, we obviously funded that with our federal ARPA allocation. Knowing that when that funding comes to an end and when we are out of funding, that will be a very difficult expense to pass off to the tax levy. It just is. And so our plan was that as we got that running, that we would certainly look to community partners and to agencies to undertake robust fundraising to continue those operations. So hopefully that's happening in parallel with the operation, because when we get to the end of the line, the last thing we want to see happen is that, we're 2 months away from the ARPA funding running out and there is nothing to keep it running. I mean, that would be, an ultimate fail. So, I don't want to see that, but I do just want to remind everyone that, we're on a limited time schedule in terms of funding, because that was not levy dollars that went to that cause. It looks like Alder McElhaney has a question.
Yeah, so I just want to go over the service data, the 1,900 plus, that's for all of your services, including the night shelter?
That's for the day center. And no, they're individual stays.
Okay.
So we count it. So let's say you were to come to the day center and check in. That's a stay.
Okay, so I'm confused, and maybe you can help me. 1,900, and that started what time?
So that was January.
Okay, I'm looking at those numbers up there, and I don't see, I just need to explain to people when they ask me questions, how does that hit 1,900? When you're talking 10, 14, 12, 20, how does that hit 1,900 since January?
So, fair question. Let me go back and check our data on
Okay.
that. Yeah.
Okay.
We want to be fully transparent with all of our data, so we're tracking that service
Right.
in-house.
Well, it's
yeah.
very important, as
Of
you know,
course, yeah.
because, you already talked about funding. We had hoped, as a council, this would be more robust, and you talked about your challenges, and we understand, and there were other agencies involved, and we understand. But this was done for a reason, into getting people a place to stay other than the library, and and to move the needle a little bit, like you said, on job searches, getting people another place to get people connected to services. But thank you for that information on the
Of course,
1,900.
yeah.
I just couldn't see it.
No,
Thanks.
thank you for pointing that out, so I will get back. And what's the best way to get back? Okay, so,
Yep, and their emails are all on the city's website as well.
wonderful. And if I may,
Alder,
just to
go ahead.
address the point you brought up, I mean, it's an excellent question. It's sort of the balance between the total number of guests served and the quality of service being provided, right? So it's something that we've been weighing out. How do we incentivize, without being able to mandate participation in a program, having people come and participate in that program? And so that's something that we need to work with the community and other partner agencies to provide something that is very compelling. As we've sort of discussed this evening, there are individuals that really don't want to be in that type of environment, and they are preying upon the vulnerable within our community. So we're trying to filter out that type of behavior and bring in the people that are needing the services that we provide, and finding that balance is challenging. So we definitely want to acknowledge that.
Sure, and
Yeah.
thank you for that. I also think that it's a bit inspiring to know that you are seeking a larger space, which obviously then would maybe allow you to serve more, both in the day and the night centers, as that space maybe would reveal itself. I know that with the agencies expanding and serving at CPC, they're kind of bursting at the seams. And so they probably could have built that thing twice as big and filled it, basically, because there's so much need, and there's so many agencies that the idea of connecting people to services all are under one roof has been revolutionary, and so good to see that all take flight. Chad Hankey has a question for you. Go ahead, Chad.
Oh, I just did some back of the napkin math, and 20 people for half a year is 3,100 visits. So
So assuming if people go every day.
I could
like-
see that those numbers getting close to 1,900.
So, yeah, just assuming, let's say the same person goes every day, it's 5 stays, right? So, that's,
Right.
and so if you are serving even, the same 30 or 35 routinely, and they're there a lot, it certainly makes some sense in the count. So, thank you for that reporting, though. Does anyone else have questions? Oh, I'm sorry. Go ahead, Carol.
Thank you. You might not be able to see my light.
Well, if I move this bottle out of the way, I can see
Okay.
it just fine. Thank you.
You said, if I heard correctly, approximately 30% are female, is that correct?
That's correct.
Okay, so that's at the Good Shepherd shelter overnight.
Yes.
Okay, that's just what I wanted to clarify, or for myself. Thank you.
Okay. Anyone else have questions at all for Nathan? Sarah, go ahead.
I just noticed that, in that, and you may not know what the data means, but in April to May, there was a really high uptick. I'm guessing the blue is turnaways, right? And
That's
the
right,
reds.
yeah.
So do you know, was there any reason for that uptick in that month? I started to check the weather. It was pretty nice.
Mm-hmm.
So I didn't know if,
That's the logical thing that you would think, that it would be weather-related, but I have yet to determine a pattern
because
in
then it
these
just
turnaways.
went
Right.
really low in May.
Yeah, and then it can drop off. So, this has direct bearing on determining the amount of services that we're going to provide, the space, all I can tell you is we know that we don't have adequate space to serve the homeless community that we currently have here in Wausau, Marathon County, based on these numbers. There are certainly times when we dip below, but given the frequency of the turnaways, we couldn't make the case that as a community we have adequate shelter.
Yep.
Okay, thank you.
That's well taken. Thank you so much for that. Any additional questions? If not, then we will also place that report on file. Thank you so much for coming tonight.
Thank you very much.
So the other agency that we invited tonight is Bridge Street Mission. We bring up Craig Vincent. He has two things to talk to you about. As a participant in our housing task force, he and Tracy Rieger and Donna Ambrose from, why can I not think of it right now? It escapes
Neighbors
me.
Place.
Neighbors Place, thank you so much. Worked together and came up with a real difference maker of an idea when the weather is extreme called Community on Call. So I've asked him to come and talk to you about that and about the expansion of Bridge Street Mission because they're working on expanding their capacity. So welcome, Craig.
All right, well, thank you for the invitation. Quickly, I'll just give you a little bit of idea of what the mission is doing currently, what we've kind of learned through that process of doing, and then kind of what we're looking forward to the future. And actually, as I start that future conversation, I'll be able to tap into the Community on Call. So first of all, Bridge Street Mission has existed in Wausau since 2016 in a very small scale, one individual family starting to build relationships with the unhoused population. And that has rapidly grown to where it is today as a small rescue mission, similar to what other cities around the country have. I'm relatively new to Wausau, but I began working with underserved populations in 1983. Try not to do the math on that there, but I've only been in Wausau for just a little over three years. So what the mission currently does is really two primary things, and the one is what we call the Outreach Center, which is really a daytime drop-in for the unhoused community. So Monday through Friday, we're open from 10 to 3, and we're a safe location for anyone to come and hang out. No programming requirement or anything like that. And so we get a lot from the unhoused community that just come out and hang out with us so they can be out of the weather and out of the downtown area. And then that's really highlighted by a really nice noon meal that is open to anybody in the community. So we get people who come to eat that meal that are housed, but they're just maybe are feeling the pinch as far as wanting food. But some just come because they want a place where they connect with other people. And so that takes place Monday through Friday at the Outreach Center. A little bit that we've learned through that, we've regularly, informally asked the question as we've gotten to know the folks, where did you sleep last night? And so we've been able to identify, and our numbers are eerily similar to the data that's being found at Catholic Charities. But in 2023, we had identified through that process 383 individuals who say they're in housing crisis. Now, that could mean they were living in the street. That could mean they stayed in one of the shelters. That could mean they slept in their car. That could have meant they were on Aunt so-and-so's couch, and she's told them they have like 2 weeks to get out. That could mean they're staying at one of the hotels, and their money's about to run out. And so we've identified in housing crisis 383. That's actually a tick down from 2022, where we had 418. And then but our percentages have changed. So in 2022, 25% of those folks we served through the Outreach Center were women. In 2023, and that's percentage is held so far through 2024, it's 34% that have been women that we've seen in the Outreach Center. So we've done that. The other thing that we do that's probably a little less known is that we have a program shelter that has been serving up to 36 men. And what I mean, it's a 24/7 program shelter, which means that when they come in, they're with us overnight, but then they're with us throughout the day in productive programming. And this is really that transitional housing that the Chief Barnes alluded to, and Tracy alluded to as a great need, is that it's actually designed, and rescue missions throughout the country have been excellent at these kind of programming, but it's designed to move a person from a point of need through some process back to where they're able to re-engage in community. So often people say, well, this person should get a house and they should get a job. It's really not that simple. In fact, when a person comes to us, we talk them out of going to work right away because we want them to engage into our structured programming to get them back to the point so that when they go out and get that job, they actually keep the job. All right, and so that program is a very comprehensive program. We won't go into the details. We could talk later if you want, but a comprehensive program that moves them, involves counseling, it involves curriculum, it involves vocational tracks that we do in partnership with some others in the community that do really, really well, like Northern Valley Industries, Goodwill, and we have our own culinary arts track. So it's a structured programming, and we've been able to serve up to 36 men. Where we're moving toward in the future, and most of you know this because you voted to help us with the zoning variance there, is that we've acquired the former Pied Piper Plaza, and we're in the process of relocating there. And really 3 things are going to happen because of that relocation. One is we're going to be able to improve our programming that we're currently doing with men. It was purpose-built for a transitional 2-phased program, and so we're going to be able to do that. They're moving in this month, so we're really close to that happening. The second thing it's going to allow us to do is we're going to be able to expand that day center location. Right now, we currently have 48 chairs in our outreach center, and we regularly are doing 90 to 130 meals a day out of that outreach center. And so we're going to be able to move in there and then have 120 seats. So we'll be able, and a nice big commercial kitchen, place to receive donations and things like that. But then the third thing that we're going to be able to do in this transition is begin this transformational programming, this transitional housing for women. And so when we're done, we'll be able to serve. When we're done with all this, we'll be able to serve up to 40 men and 20 women in our recovery reentry programming. And I think that's going to be a game changer for our community to have that programming available for women. It's very interesting. The way we really got to this building was the current owners came to us and said, we have this space that is not being used. It's been vacant for over a year, and it was that winter that we had some people die because of weather-related things on the street. And their motivation for approaching us was, we want this property used. And so they just wanted us to rent, but we asked the question, would you consider selling the whole building? And they said no originally, but 6 months later we owned it. So they changed their mind. Our board took some courageous steps to move forward. The council approved the zoning. We were able to get in there and go. But what's interesting in 2024, unlike some of the other communities around us, we did not see a weather-related death in the city of Wausau. And so I just want to, that really was something that Community on Call was able to address. And so this was a little small committee, Tracy, myself, Donna from Neighbors Place, and Jeff Hancock, who at the time was with Catholic Charities. We sat down and put together a rotational model for an overflow shelter. And so this involved really recruiting churches, businesses, clubs to provide temporary space for a week at a time so that when we hit the temperatures, we'd be able to transport some of the folks from the Good Shepherd shelter, and we're really to sending out the more behaved folks, the ones who are doing well, out to these rotational shelters, which opened up then more space at the Good Shepherd shelter that the police could bring people in, or someone who maybe normally wouldn't come in off the street to get out of the severe weather. And so that has gone well. We were almost considering having to open it because it got up to a 91 heat index just a couple days ago. It's gone well. We still are somewhat struggling, I would say, to get enough partners to fill all the weeks that we've had. So that's an ongoing thing that we're doing. I think it's not from lack of interest. I think it's somewhat, we're all kind of busy in our roles, and it just seems to always get more busier as you go. And so some of the coordination we could do better at with that. But we're committed to making it happen again and doing it in the future. So I'll just quickly mention that to do this expansion and acquisition, we began a $5 million capital campaign last September, and we're actually at 48% already of that campaign of pledges that have been made, all private dollars. And so I did bring about 5 of these along, so if somebody wants to see afterwards and get some information. Some of you have been there, and I do also, we've done tours, and we'd love to do more tours and show you that space. One of the things that we're excited about the space is it has a area where the thrift store currently sits. They've decided to relocate, and so we have that space available for rental to other nonprofits. In the future, we could expand programming there, but we don't want to do anything that prevents us from getting the women program running. That's the priority. So that space will be available for other nonprofits to rent until we get all those other programs up and running, and then we'll see how those relationships are going. So yes, see me for a tour. If you want afterwards to get one of the packets about our relocation, it's here. So I can take questions.
Okay. Thank you so much for that. Exciting things happening over at the Mission, and I would encourage everybody also, if you've not had the tour, to contact Craig offline individually, schedule a tour for yourself. I think that also is less conspicuous and less invasive to operations when you're trying to work during the day. It's much easier to take 1 or 2 of us through than 11 at a time. So there's that. I also just wanted to comment on Community on Call. I think that really was a difference maker for us last winter, and I'm so excited that that took off. I know when they first started a public interest meeting to at least introduce it to the community, there were a lot of agencies that showed up that just wanted to see for a little bit how it went. Like, let's activate this a couple times, because if someone does commit to or an agency or group does commit to a week, they may not be called that week at all, or you may be called 4 or 5 times, depending on what the weather does. So, I would certainly hope this year, though, having a year of experience and being able to talk with those who've had the experience of opening their doors, bringing in the equipment, taking those opportunities, that perhaps more agencies will volunteer, being able to hear a testimonial from those who did it last winter, because that was huge for us. So,
And we're committed to make it happen, regardless of how many
right.
are able to
So
participate.
good. So with that, anyone that has questions for Craig, Alder Gisselman, go ahead.
Thank you. As you transition to your new facility on First Avenue, what about your current,
good.
your facilities that you have now?
Yes, I'm glad you mentioned, I actually meant to mention that. So, yeah, so we are doing this as a relocation. We are not going to keep running those programs separately. So our outreach center has actually sold, and we have an agreement with the landowner to rent it back until we move. That's at First Avenue. And then our sober living center up at by Newman Catholic up on 1140 Bridge, that actually sold twice but hasn't closed yet. All right, so it is available and for those for anyone really to use to how they want. So we've had people from around this table who've looked at it. So we're looking to move that.
So the Bridge Street, the Newman, so is that going to stay the same, or what?
Well,
or how
we are hoping to sell that. We're hoping to sell that.
But no sense of what that will become later
Well,
on?
it'll depend on who the buyer
new
is.
owner would
Yeah,
be.
so some of the people have looked at it. We've had a range from an individual in the Hmong community that wanted to use it for elder care. We've had others that wanted to use it similarly to how it was used again before us, as really like a low-income housing type setup. And so we've had a range of of different folks who've looked at it.
All right,
So
thank you.
we really can't control what they do once they own it. But our hope would be that it could be used to further serve the community.
Sure. Okay, that's good stuff. Does anyone else have any questions for Craig? If not, thank you so much for coming and sharing your evening with us. We're kind of getting down to item number 2. Just a couple things that I wanted to point out. I had mentioned earlier about individual tours at CPC. This morning, I talked with Kevin Noel, who was critical in the creation of CPC campus. He is willing to offer those tours to anyone who wants one anytime. Just reach out to him and you can have that. Those tours, the agencies that are operating under that roof, connecting people to services. One of the things that became apparent a number of years ago was that a person in need of services, when they were spread all over town, could spend an entire day trying to traverse the city to get the services they needed, assuming they knew they were there in the first place. And so bringing those things together under one roof has been huge. And just to connect, and the agencies operating in there are there's just so much activity in that building during the day when they're there. And they really are making that impact, and I think moving the needle for the community. The other thing I wanted to mention is our housing task force that the United Way is running right now is going through a series of results-based accountability workshops that Administrator Leonard mentioned with some employees from the health department that specialize in that to figure out essentially what's next. And it really is 2 words. I mean, what's next? Because they've done a lot of things and they've gotten a lot of results. And it really is taking stock of what those next step looks like. Do we have the right people still at the table? Are there people at the table that we need that we don't have? And are there people that have served out their mission and gotten the result and then are clear to move on? So that's going to take a couple months to push through, but there's some good discussion happening around that. Before we switch to item 2, which is kind of a discussion part, Alder Neal.
Oh, well, I intended this to be part of
Of
2.
item 2?
Yeah.
So item 2 really is kind of a flowing discussion among us to ask ourselves what's next. What would you like to see, I mean, as part of our part 2, things that we want to develop or that we want to find the right partners as far as a path forward, what that looks like. Are there new partners? Are there opportunities that you want us to be exploring and bringing back to you for the second meeting during this off time? So go ahead, Alder Neal.
Okay, well, I think this is a perfect dovetail then. A few days ago, I had a discussion with a local retired architect. And now that he's retired, he's for a while, he's been giving a lot of thought to the homelessness issue in Wausau. And we spoke at length. He was particularly concerned about people, let's say, who have served in the armed forces and are now finding themselves at loose ends, no place to stay, maybe having troubles with abuse, that kind of thing. And he's just really been looking at possible solutions that could be achievable here. Now, we talk about affordable housing, and we talk about projects, and we do know that just to build, like, let's say, a 40-unit affordable housing building, you're talking, a developer who's going to go through the hoops to get the funding available for that sort of work. You're still talking millions of dollars of project work, and that makes it really hard to pull together these kinds of projects as much as we want them, and we have to keep pursuing them, but they're few and far between and hard to land. And in the continuum of the unhoused population, we see all sorts of individuals from the most, I could live in the woods forever and just come downtown for some of the resources available there and then go back to my tent or whatever, and those that are seeking to be under a roof and to get themselves out of that situation, maybe in need of transitional housing, that sort of thing. So he shared with me something that I've been thinking about in the back of my mind for a while, but he kind of brought it more clearly to me. You know, we've heard a lot, you know, lately, not necessarily just for this subject matter, but the whole idea of mini houses. You know, you've seen even the trendy little mini houses that people, you know, build somewhere, and it's really, really groovy. But he mentioned a program it's related to, and Caitlin, I wonder if you could fire up the web for us?
It's fired up.
All right. And take us to palletshelter.com. It's PALLET shelter.com. Now, this is only one of probably numerous, it doesn't look like it's a nonprofit because it is a .com. It's a business. You know, they make what are called pallet shelters. Now, it's not that they're shoddy little shacks made out of pallets. It's that they are prefabricated in their production facilities and delivered to your site like on pallets, essentially. There's a whole bunch of different kinds, but what we were talking about are like these single-person dwellings. And I see what a S2 sleeper is that for? It says for 1 or 2 people. There's a variety of floor plans available. Essentially, these are inexpensive. You know, we could probably look at 20 to 40 units in the maybe $200,000 range, rather than, you know, $2 million range. So we could be serving, you know, 20, 40, 60 people, possibly 80 people, with sort of a little village of 20 or 40 units. This is not like a big city block. I mean, this could be a relatively small, tightly knit community. Now, we do know that our unhoused population tends to gravitate towards the center of our city, the downtown business district, because, well, that's where they'll find access to many of the resources they rely on. That's where they find meeting places where they can, you know, join their friends during the day, that sort of thing. So you don't really, it's not as palatable, pun intended, for them to be way out, you know, somewhere on the west side or whatever, because they have maybe no means to get to where they need to be. So our center of our city area, the greater downtown area, is really you know, ground zero for trying to find a place for such a little village. Now, we did discuss one particular plot of land that is currently privately owned. I don't want to state what it is here, but I would like to, you know, consider going, staff having a look at this and talking to the owner about purchasing, perhaps even leasing it for a multi-year period of time to erect one of these small villages. You know, the things that you're going to look for there are, well, is it, you know, out of the way? Are we not going to have like the NIMBY problem? Like, well, I don't want one of those by my house and everything. So to find the right place, you know, is critical. But I think it's very doable within the parameters I've been discussing. So this is something that it's a much lower dollar way to address, you know, I hear the numbers that I'm hearing here. A large percentage of people that might be out there like in the woods at this time, or under the bridges, in, you know, in the winter or whatever. Those individuals. And, you know, the person I was talking to, the retiree, I mean, he was really concerned about veterans and you know, providing for them. And we discussed about, well, I mean, should this be something sort of incentivized or qualified for people that, you know, can apply for the, you know, these kinds of lodgings? And one, you know, high mark might be, you know, having served. Others might be engaged in an ongoing treatment program, that sort of thing. So it's not just, hey, let's go to Wausau, it's all free there.
Sure.
No, I have to be qualified in one way or another to take part of this program. The nice thing about this program is you could look at it, you know, a few years down the road, and if needs be, you could look at expanding it maybe with a different footprint. And maybe if we've settled some of our transportation issues, maybe further out. So at any rate, this website, and there are many others that do this kind of thing. There's funding available from various sources, whether it's state, federal, local foundations, or the city's own larder, because it's the kind of numbers you can look at and say, well, that's not too far, beyond the pale. So I'm hoping that this, maybe just my introducing it here tonight, might get a ball rolling where we can kind of creatively address that continuum of need and not be too focused on just this and just that, but there's more than several ways to skin a cat. And
Certainly.
I think looking at this like through the CDA and through our community development department, there might be something that we could figure out here, and it might be interesting.
Sure.
And helpful.
I'm making notes as we're talking. That's the thing. I think the question we've talked about similar efforts before. The key is the city proper should not run it. We certainly can partner on the development of one, but we would certainly need, a nonprofit partner to run it and manage it, make sure that it stays safe as well. Mayor Rosenberg and I had talked about something similar a couple years ago. Minneapolis had similar issues to what we have only on a way, way bigger scale. With their North Loop downtown. And so they had invested a sizable amount of ARPA because their allocation was way more than ours. But they invested, these pallet homes are individually heated and cooled.
Sure.
What they built was something that was one large building, and it was sectioned on the inside similar to this. So everyone had their own space, but it had common HVAC.
Yeah, I
And so-
didn't mention, but even these little small units have integrated heat and cooling.
Yep.
And this particular outfit did do a project, and it's in their list of projects in Madison. I think it was only like 20 or 30, 40 units or something.
Sure.
So there would be a sort of a case study on that available here to look at, and they've also done several others. So
Sure. Definitely worth talking about or looking at. Alder Larson.
Thank you, Madam Chair, and thank you, Alder Neal, for bringing this up, because I was going to bring it up, but it's interesting about those pallet homes. I didn't know the pallet homes, but we have been talking for as long as I've been on the council. This is my third term, I want to say. About tiny homes. We've had, I believe, Sandy Kelch had gone down and toured the Madison facility down there, and how it blended in with the city and stuff, and the people had no qualms about it. I mean, you talk about lands, and we've got city-owned and county-owned lands. We've got land right downtown where the Marty bus is. We could put a little community downtown, I don't know if the city owns that land where the laundromat used to be. We could definitely look into something like that, and I'm glad you found those pallet homes, because that looks something that actually is doable, instead of, I go on Facebook or wherever and I see all kinds of extravagant tiny homes, but I see a future there, and I see a future in this community, and I'm disappointed that we've kicked the can on this issue for so long. When it comes to the tiny homes and stuff, and I think it's time that we move forward with this.
Sure.
Thank you.
Okay, I made a note about that. I also wrote next to that, look for partners, because, there's a lot of initiatives that we've been a partner on that are not solely city initiatives, which is super helpful. Alder Watson.
Thank you. One other thing to think about is we have those parcels that we're going to be building on in a couple of years. We could always, if they're on pallets and they're transported around, couldn't you start them somewhere and then move them around too? But anyway, my suggestions would be, I think a comprehensive database of of the people that need services is crucial. It sounds like they're starting, on your housing task force, they talk about local case conferencing. That sort of seems like what that is, but maybe it has to be a little more rigorous.
Yeah.
Because it seems, I guess the frustrating thing for me, and probably for all of you, it seems like we're silos working on the same issue. It's not like there's not a lot of minds already thinking about all these things, but we're working on them in our little silos. And so I know the Housing Task Force through United Way is a great place to start, but maybe there is like something that we as the city and county partnership can get something going. Because there's a lot of things that that you mentioned, you know, that I hadn't known that the county was doing. And if we can like all, I don't know, share information, that's pretty key. There was something I found too that goes along the lines of like sharing information or comprehensive information. There's something called community solutions that a lot of municipalities have sort of started to try to get to that functional zero of, it's not gonna eliminate homelessness, but it's gonna get it to as low as we can possibly get it. And Rockford, Illinois, a neighbor to the south, has claimed to get to that functional zero, and they've used this process of having a database of who are the people we need to serve, because that really dictates what we do. Because if all of them have this same characteristic, then we can create a program like that. Like for example, with this Rockford program, they found that a lot of their homeless people were youths that just came out of school, and they were in that transition. So they hired somebody that focused on the youth transition. So I mean, if that's what we see, that's what we need to hire. But we don't know really from the data we have. We don't know age, we don't know length of homelessness. I mean, that's the data we need.
It is, and
So-
the task force has struggled a little bit with, we started out lamenting the lack of case conferencing. And then, so when we talked about that, which case conferencing in that context is multiple agencies individually conferencing about a specific case and how to get person A to a better place, all working together. And so the trouble with that sometimes is there's a serious element of confidentiality between agencies, and their grant funding often depends on it. So, you know, I think that kind of getting over that hurdle to getting agencies to be able to participate together and get that networking happening is super helpful. But we talk about that a lot in the task force.
Or is the way to, because it's probably HIPAA issues, right? Privacy and
Somewhat, yes,
confidentiality.
somewhat.
Like, is there a way that we can partner, like, we can be in control of the database, or somebody, like, I know that's the government having information, which is probably not the best, but.
Well,
you know.
right, I mean, there's maybe some trust element there too,
Privacy,
but I
yeah.
think that, you know, it's certainly worth discussing to see what's possible. Because sometimes even if it's non-health information, you can still glean enough from other information where you can find common demographics with common needs. So I agree with what you said. Alder Lukens.
Thank you. I like, excuse me, Alder Watson's idea of the database. And I guess just one thing I'm thinking of course, because I'm in the schools, you know, I don't know, I don't even know how to what extent it relates, because I know the people visiting the shelters are probably not, you know, they're not, well, some are families, but, you know, I have worked with, and do work with students who are unhoused, but, you know, do have temporary housing and motels and things like that, or sometimes with other people that they know. So, and it's not just short term. So I guess maybe, I don't know if the schools are part of these, you know, the task force, if they're one of the entities, you know, but I guess that would be one of my questions too.
They
Is
are
there a
not
way-
currently.
So, you know, if there's a way we could hook in with the schools and maybe creating that database. So, because when we think about the tiny homes, and I'm definitely like all for looking into that, you know, as well. But I guess my concern with that, and I have not visited the Madison Village, so I would like to do that. But again, would be that other aspect of, you know, partnering with another agency, a nonprofit, whatever, because if, you know, a lot of the issues that go along with homelessness, then, you know, how are those other wraparound or those services being provided. So I would like to see that, all interacting.
Sure.
But anyway, thank you.
Okay, thank you for that. Anyone else have any ideas that they want to share at this point? And I mean, obviously, after this session, too, you can certainly circle back to me with a phone call or an email if you want me to add something that comes to mind to our list. Alder Gisselman.
Well, yes, thank you. I just would like to know a little bit more about the transitional housing, who runs that? I mean, is it the county or the city or community? Just a little bit more to know how that actually gets organized, gets funded, and who actually is the government or non-government nonprofit that actually sort of runs that type of housing arrangement. And maybe somebody here can answer that, but I think that that's maybe one of the things a constant that I heard tonight, that is an issue that I think is facing the homeless population. I would also know that there are some people here that may have public comment. I don't
Yep,
know.
we're going to take some, once we get through our discussion, we'll offer an opportunity at the end for some limited public input as well. As far as the transitional housing model, you're interested in who runs it and how it's funded, right? Is that, okay?
Sort of how it's organized. I heard
Yep.
that from several people this evening.
Yep,
I heard that from several people this evening, and I think that maybe that's something we should put on our radar.
sure.
Thank you.
I will definitely write that down. I mean, what we heard tonight really is that there are a number of agencies that are providing transitional housing services as part of their individual programs, but there's no one central source that's like the one, So, I mean, built into some programs that already exist, that are already working, there is some of that, and that's part of where I think the deficiency that Tracy Rieger had identified in terms of both rent readiness and then case management to keep people housed once she gets them housed. Is where she's saying she needs some help, because even beyond the programs we already have, that are functioning, chances are folks receiving those services now are involved in other programs within other agencies. But if they're not yet, and they're just getting ready to go from that street component where they're in survival mode to housing, what keeps them there? And where is there a gap there between enrolling in another program that exists and that exit from the street? And I think we identified that we do have a little bit of a gap. We used to have what we like to call a first stop house, where you'd have some time to get your feet under you and then figure out what programs to enroll in to get where you're trying to go. We don't have that facility right now, and without the proper management inside of it, it doesn't work anyway, because we don't have those people. So, we do have some gaps, some definite identified gaps, but I definitely wrote that down. Does anyone else have anything else on the subject? And if something comes to mind, the other piece that I left in my little notes here was closing comments from either council members or the mayor before we open up some public comment. So, Mayor, do you have anything that you'd like to throw out there?
Sure, and I'll keep it simple. I heard the same thing Gary heard. We heard it from Tracy, from PD, from Bridge Street, Catholic Charities, and the county. Is the transitional living. Now, the transitional piece is that connector between the emergency, keep you from dying on the street level, and then getting into a house. We've relived this a number of times. We're taking somebody right from the street to a house without some support mechanism.
Yes.
Is usually a failure, and Tracy can speak to that. But we have, so not every. In some cases it works, but not in most of the cases, people need some assistance there. So the transition, and this is where Kurt Vinson's the expert, we should lean on him, is how does that transition, how is it staffed, how does it work, how is it programmed? So no one entity, no single entity controls that. And I guess my thing that I'd like you to think about is, how do we, so if I was to simplify it, to me that jumps out as the big thing. We've got the deflection and diversion, reporting barriers. We've got the foot patrol doing their thing. I mean, there's there's not, in my opinion, it's going to be difficult to wrap our heads around the entire process. And that's where I think maybe the city-county arrangement will help do some of that, and then focus. So we really need to focus on what we can affect. So what I would ask alders to do is, after you digest everything you've seen here, try to define for yourselves what the role the city plays in this complete system, ecosystem of trying to help our unhoused population. What does that look like? How does maybe a city-county blue ribbon committee help that? And then, ultimately, you're going to have, because we've got a lot of good ideas, and I would start from the position that they're all good ideas, from the tiny homes to additional support for Tracy with programming or case management. But we're going to have to understand at what our role is financially, and that's where I think if we can do something with surrounding communities, with the other organizations, and we can, because we're not going to do it alone. So I think together we do more than individually. So I start thinking about how do we weave the rest of the community in, and are we the driver? Are we participant? Are we funding? Where do you see the city? Because, it's all going to come back to how do we pay for it, and how can we work it in, and if it becomes a priority, we can put all of the wish list things on and find out where we want to spend the money. Emergency, I think everybody would agree, emergency services are probably the first priority, because that's where you keep most people from dying under the bridge. And then you've got to figure out how to transition out of there. So that's my 2 cents. Transition, work within community, and define our role.
Okay, thank you. I did write that down. I agree. I think that there maybe is opportunity for a task force and figuring out where we fit in terms of the solution. That's something we've struggled with for a while, is figuring out with the right partnerships, like where local government fits as part of the solution. Are we the organizer? Are we a participant at the table? Are we a fund source? Are we a conduit? Are we a pass-through for other funding? Sometimes that happens. So those are the things that we do need to figure out. Alder Gisselman.
Thank you. Just on coming from Carol's statement because one of the underlying things I think that we also should be thinking about is how close a lot of people are to being homeless. One check, one payday away, perhaps. The issue with regard to evictions, is that an issue that is part of what we should be thinking about? I don't know that, but I think that's something that if that's happening, if people are very close to becoming homeless, are there steps that we should be in front of people to prevent them and taking and easing them out of the perilous position of being homeless? And I personally, for this evening, I just want to close with the National Homeless Law Center's vision is to cultivate a society where every person can live with dignity and enjoy their basic human rights, including the right to affordable, quality, and safe housing. And its mission is to fearlessly advance federal, state, and local policies to prevent and end homelessness while fiercely defending the rights of all unhoused persons. And I think we as a city council should maybe start with a vision of how we see that vision of how the city starts to deal with we deal with it, of course, but if we are to proceed, what's going to be the guiding light to our proceeding down that path of dealing with our unhoused population. So with that, thank you.
Thank you. Definitely noted. I did like some of the things I heard within the county agencies and their programs already functioning that are really assisting individuals that are at the cusp of homelessness. in terms of avoidance, like family keys and things like that, where, I think there's probably room, I think there's always room for all of the things that get done to do it bigger and more, but it's about staffing and funding. But, when we get to a point where people are at the cusp of becoming newly homeless, obviously, programs that help people avoid that situation and stay on a track of stability is key to all of our efforts. And, we really do have, situations where you have people who've become newly homeless and people who've been chronically homeless for some time, and their needs are sometimes completely different. One thing we hear in the task force a lot is that the 30-day number comes out, and it says that usually if you can get someone on a path out of homelessness within that first month, before they have existed for a really long time in a state of survival mode and ongoing suffering and ongoing addiction or whatever the contributing cause might be, your success rates are typically better. We keep hearing that from our agencies. So I definitely wrote that down, though. Alder Lukens, and then we'll take some public comment.
Thank you. So just to circle back around to the children, I guess I'll just relay, the students or kids tend to live what they see, right? And so that's what they're learning. And I had a student say to me one day, because I said, like, what do you envision? What do you want for your future? And he said, I don't know, I probably live under the bridge, and so I mean, I want to bring that perspective. I know it's not who we are specifically or what we are specifically talking about tonight, but regarding that, I'd like us as a council to keep in mind the need also for affordable housing to help keep people out of, becoming unhoused. And, zoning, I've read so many sources and listened to so many different sources trying to learn, more about that. And affordable housing, I guess, it's hard when we have meetings and we have decisions to make on zoning, and there are different perspectives and competing interests or perspectives. And I think, zoning is something that's going to be really important for us to keep in mind. And also immediate costs, when it comes down to spending a certain amount on something, the immediate, we may not want to do that, but I'd like us to think long-term too of the affordable housing and how important that is. So it is an important part of this whole issue. Mm-hmm. And we're always going to have people that are going to be against, just thinking back to the Wyatt Street, issue, it's hard because we have people that come and they are against, it, and then people who are for it. But I guess one thing I would like us to think about is, what is that housing going to be used for? What can that be used for? Who will it benefit? And how much of a need we do have for affordable housing. So I'd like us to keep that in the forefront of our mind. And then just that last thing about, the wraparound services. Yep. Thank you.
Thank you so much. Alder Neal.
Thank you. I pushed my button after you said we were going to take public comment next.
Oh,
but
I'm going to let you be
maybe
last.
just a parting shot to kind of put this in perspective. I take to heart, what the mayor is saying about, how do we pay for these various things? And I understand that concern. But, I've kind of heard the same thing in the past when we're talking about bus service. Mm-hmm. Why are we paying for bus service? Yeah, I don't use the bus. I look at it's half the time it's empty. Because we're a city and we have a population that relies on that requires that. some of them on a daily basis, whether it's going shopping for groceries, whether it's going to a medical appointment, whether it's just getting from A to B. We as a city make it our business to serve that element of our population. It's part of our altruistic reason for being the government of this city. And we find a way to make it happen. Sure, and we're gonna look for all kinds of funding sources, whether it's some state funds or some federal funds or wherever we might look for money to help us pay for it. But ultimately, we pay for it because it's something that's needed. And when we look at our unhoused situation and our need to address it, it is something that is needed. It's not an option. It's not something that, while we can get around to it if we can afford it. I mean, there has to be no stone left unturned, I think, to try to find feasible ways to address this, whether it's a one-person shelter program, village, or whatever, to all the other elements that we talked about. They're going to require partnerships. They're going to require us traveling to D.C. and rattling some cages there. It's going to require us going to Madison. It's going to require us to fill out forms, make phone calls, and to be advocates. But that is our job and our responsibility. It's our ethical responsibility to deal with something that is, present in our community.
Sure.
We can't just say we can't afford it.
Right. And that really is, I think, as we have talked about this a number of times, I mean, I've actually sat through this discussion. This is probably my third or fourth time since I've been on the council. One of the situations we had prior councils and prior to ARPA dollars, because we made really a large amount of ARPA commitment to addressing a lot of these things. And without that, I don't think that half the things that we achieved could have been achievable. And, that was like generational funding, and it was a one-time deal. And that was really the component that brought us to the table. We always were at the table in the discussion, but we were always at the table with no money. And we would have conversations with nonprofit agencies who would say, great, city, you're at the table, but, where's the money? Because, they're all fundraising from the private sector and capital campaigns and whatnot. And we just didn't have it to give. And so we really were not a productive player at that table, other than being listening and figuring out were there policy things that were creating roadblocks to the work. And that really was where our contribution was very limited, because there just wasn't any money. Once we had that unprecedented money and we were able to come back to the task force for initiatives and push things forward with some actual funding, that's when things changed. And so I think you're right about trying to find ways to leverage, whether it's grant funding, state, federal, whatever. I mean, that's going to be a key part of all of this. So, but definitely your points are well made. So that said, we've had our closing comment from all of us up here. There's obviously no decision to make tonight. There's no policy decision to be made tonight. This was 100% informational, so that we all are caught up with what's happening in the community now. And, obviously we'll have a part 2 of this coming in the fall, once we have a chance to chew through some of our notes tonight. So with that, the hour grows late, but if anyone wants to make a brief public comment, we would entertain some of those at this time.
I had prepared something, but I'm going to disregard that based on the conversation tonight. Thank you for bringing up the tiny home villages. There's so many unique ways and cheap ways that we can do this. I do want to say that I think there's several voices that are not being heard. First and foremost, the unhoused. We hold these meetings when they can't attend. When they do attend, sometimes we're critical of their past, sometimes their present, but their voice deserves to be heard, because we are not in their shoes. And to know how to help somebody, you have to listen, regardless of behaviors. And I'm a corporate guardian, and I have had to learn that in my job daily. With tiny home villages, you had mentioned making them portable. You can have multiple villages. To keep the costs down, you can have volunteers. And somebody had brought up Madison, Occupy Madison, and their village. And that's what they do. Their villages cost about $250,000, probably mostly on supplies, because the volunteers put them together. We do have some homeless population that would be able to help and could take pride in building their own home and building their own community. Obviously, there are some that aren't in that position, but they would be helping themselves. And that is something that has been requested for a long time. And to make them portable so that when a location does not work anymore, or there's a need for a bigger location, having wet villages, dry villages, women-only villages, couple villages, family villages. I mean, it's, we've watched the city snowball in the wrong way with homelessness. This could start off with one snowball and turn into an avalanche in a positive way, in a huge way. And so a friend of mine attended tonight with me, and she lived in Wausau, grew up in Wausau, and has returned, and we have had many discussions about Wausau as it is today. And she had said something that struck me this last week, and that when looking at a community to move to, how they treat the most vulnerable is how she picks the community that she would like to reside in. And we talk all the time in this chamber about drawing in wealth and tax base, and I understand that that is needed. And that can happen when we do innovative things like this. It can draw in people with funds and tax base and compassion, not just funds, tax base, and, for lack of a better term, greed. And so I think Tiny Home Village is something that I would really like for you guys to take a look at seriously. Neighborhoods was brought up. I experienced it. I worked with the unhoused solely for a number of years, and I have never been afraid in my work. At that meeting, I was afraid to walk out in the parking lot, and these were housed people screaming at me, yelling at me, threatening me. And yeah, it was bad. Yeah, it was bad. And so, looking again at Madison, they pulled the very first village. I believe they have 3 now. They pulled the very first village. The neighborhood was 100% against it. They built it anyway. Brenda Conkle is the driving force of Occupy Madison, and she is an amazing woman. And if you do a lot of research on tiny home villages across the nation, you will see her name mentioned often in the research and stuff. But anyway, she had bullied her way through, got the village. A year later, they pulled that same neighborhood, and almost 100% were for it. They became a part of the neighborhood. One of the villages exists, and right next to it, a high-rise, very fancy apartment building is being built. So again, it's not a deterrent from a growing neighborhood. It's not a deterrent from tax base. If it's done right and slowly, and learning from mistakes and admitting mistakes and changing to accommodate those mistakes, it can be done. One of the villages is self-governing. They have an advisory board of volunteers when they cannot solve their own issues. Another is also self-supporting. They make crafts and use their talents to support their own village. So, and then just finally, there's talk about heating and cooling. There is a couple in town. Personally, I think their design might be a little too fancy, as somebody had said, but it is really nice. But they had a slanted roof for solar heating or solar power. So again, something that might cost upfront a little bit more, but in the long run would make that village totally self-supporting. So I do appreciate the conversation tonight, and I do appreciate the fact that we could have public comment. So
Sure.
thank you.
Thank you, Cindy. Any additional comments as we wrap up tonight? If not, I think we will, oh, one more?
Thank you. I just kind of want to reiterate what was also said tonight and add to it the idea of like a jail discharge planner or a coordinated reentry program within the jail, and kind of just, again, wraparound services working with these clients to really hit on like every aspect for entire care for individuals. Client-led is usually always the best because if they have some buy-in, it's going to obviously be more successful. But before clients get reintegrated back into the community from jail, that's a very vulnerable population. And a lot of times they just get discharged back into homelessness, unfortunately. So communities around us have jail discharge planners, and they will say it hasn't been the easiest road, but the successes that they've had have been very important for their community and keeping that positive energy going for it. But again, working with all of the community players that we have already in this community to work with these people to focus on getting them housed. Again, this is before they get released from jail. Getting them housed, working on stable income, whatever that looks like for them, whether it's employment, SSDI, things like that. Focusing on substance use disorder and mental health treatment while they are in jail and we have access to them is critical, and focusing on that cognitive behavioral strategies so that way when they get released, they have these new patterns and ways of thinking so they're not falling into the same people, places, things. Keeping the community supports, again, active long after they are released from jail and started way before they are released. Transportation, as mentioned before, and then their physical health, so making sure their insurance, they have food share if they're applicable for it, all of these things. That sometimes when they're released, they don't have their Badger Care active, so they need to reinstate that. They don't know where to go. It's hard to get there. All of these things that pose barriers. And then also reestablishing like family connections and things like that are really important when you talk to this population, whether it be with their children or their family or things like that. So again, this really big idea of like we have these people in the community, but we really need to work together, and it starts long before, whether it be in jail but treatment, whatever that may be look like, whether it is for mental health therapy, substance use disorder, things like that. But it really needs to start months before they're released, and then continue long after that they are released from wherever they are. So.
Thank you for that. Just so we have the minutes right, state your name and address for the record so that we get your comments correct.
Kaylee Wood, 745 M Street, Wausau.
Thank you. Okay, one more. Tom Killian, welcome.
Thank you. Tom Killian, 133 East Thomas Street. I think some things were said in public comment that make a lot of sense, and part of it's about the humanity of things, and I think there's some low-hanging fruit for the council. Alder Neal had brought up ARPA funds and residual ARPA funds. I mean, there are things as basic as facilitating humanity in allowing people to execute bodily functions. One thing we have not had in town, despite years and years of the community asking, is porta potties, all right? It shouldn't take the Manhattan Project to make that happen. So I would ask that the city leverage its collective cognitive and fiscal power and finally make that happen. Another thing in terms of humanity, some on the council like to relate things to business. Okay, well, one of the commenters mentioned not speaking for people always, but asking them what they need and desire in these situations, letting impacted citizens do that. Now, some of you know from marketing and business, you can read Lean Startup by Eric Ries. That's what you would do. You don't get a bunch of executives in a boardroom and try to predict and guess what your customers need. You go out and ask them, and that's what the city should be doing in this case, not some top-down approach, but actually getting out there, interacting with impacted citizens and maybe asking them what they need and desire. And the mayor mentioned in June last month when he talked to the Daily Herald that enforcement is not the solution. He's correct. That's the correct position. Enforcement is not the solution. Why didn't we talk about that more tonight? Because incarceration is a problem. Increased criminalization and incarceration is a problem. And it goes back to humanity and dignity. If you won't even give people a porta potty, why are you allowing the police to charge them with disorderly conduct for public urination? That's on the city if it won't even do the basics of providing that, not to mention the bogus bail jumping charges and so forth. So that goes to another element, and some of these issues are hard and they're worthy of debate, but the city has had trouble in the past with things like environmental issues because it wouldn't heed the words of experts, and experts are saying that you need alternative outreach teams that do not involve the police. So I'd ask you to look into the people's hearts and needs and look into experts' words and try to do better, at least at the most basic level. Thank you.
Thank you for that. With that, we'll wrap up tonight. We've run a little bit over, but we are, at this point, I think we've gathered enough to go on. We'll develop that second session for the fall. Thank you, everyone, for hanging in there with us tonight. I'll take a motion to adjourn. Motion from Lucan, second from Watson. Members in favor signify by saying aye.
Aye.
Aye, opposed? No one's opposed. We'll stand adjourned then. Thanks, everyone, and thank you, invited guests, for your comments.